Good afternoon and welcome to Senate Judiciary. We're going to start the day by opening the public hearing on House Bill 224 and call the prime sponsor, Representative Wolf. Good afternoon, Representative.
Good afternoon, Madam Chair and members of the Senate Judiciary Committee. I'm here and proud to introduce House Bill 224, a straightforward bill that would remove the criminal and civil penalties on New Hampshire doctors and healthcare providers. I want to assure you, if and when we repeal the criminal penalties, there are other avenues that already exist to ensure provider compliance with our laws, including the Office of Professional Licensure and the Board of Medicine. And there's also the ability to have criminal charges for assault and battery. This specific carve-out is redundant and unnecessary. And I'm sorry.
It's okay, Representative. Please
Okay,
continue.
well, you can hear me, so that's the
I can hear
important one. Or it's four of you. There are unintended consequences with these penalties that were never anticipated when the Fetal Protection Act was passed in 2020. We have heard directly from doctors and nurses across the state, including Dartmouth. Criminal penalties discourage providers from relocating to New Hampshire to practice. This reduces the availability of highly specialized providers. A few weeks ago, we received news that the 11th hospital in the state in the last 20 years is closing its labor and delivery service. There are only 15 hospitals in our entire state that are still delivering babies. Another birth center is closing this year. We need to do everything that we can to attract and retain care providers, not deter them from moving here. A further reduction in trained maternal fetal medicine and neonatologists means that there are fewer people to care for all of us, our wives, our daughters, our sisters, and our children. The criminal penalties are unnecessary, and I'm ad-libbing in here a little bit, so bear with me if I don't get it right. A doctor goes through 4 years of undergraduate degree, 3 years of medical school, 2 years of residency. That is one huge investment. I don't know any doctor that is going to risk that investment by not complying with the law. But they have to sometimes make split-second decisions. And having this penalty hanging over their head causes those decisions to be made in a more lengthy time. The criminal penalties discourage medical students and residents from training in our state. The chair of obstetrics and gynecology at Dartmouth, Dr. Elena Cass, said this explicitly during the House committee hearing that a little more than half of residents at medical schools stay at their location to pursue jobs. So if our laws discourage students from coming here to train, we are further reducing our workforce. I know she's here today as well, and I'm sure that she can address this better than I can. But our patients should expect our providers to provide the best clinical care, not health care restricted by considerations of civil or criminal penalties. Again, there are systems in place to address compliance. We do not need to have added penalties on our doctors and nurses. I know you've heard the facts, and you'll hear a lot more from other people that are going to speak today. But I think that if we believe in the Fetal Protection Act, as I do, we need to provide more people, more doctors to take care of our infants, our fetuses, and our wives and children. This has driven my passion to provide more and better maternal health care. And I'd like to tell you a little story about why I think we need more doctors. As I said earlier, there are only 15 doctors, 15 hospitals, birthing centers in the state of New Hampshire. 1,400,000 people, not a big number. 10 months ago, my daughter was being treated at Plymouth Hospital during her pregnancy. As she was entering the final days of her pregnancy, when something didn't feel quite right, she was able to go to her local hospital, Seaver Spear in Plymouth, a hospital that had not closed its birthing center, as Franklin, Laconia, and several others had done. Her obstetrician realized that there was something terribly wrong. Within an hour, the baby was born on an emergency C-section. That baby was born with its umbilical cord wrapped around its neck 4 times. She survived because they didn't have to drive an hour to Dartmouth or an hour and a half to Boston. They had a good obstetrician just down the street. The state of New Hampshire needs doctors like those who saved my, my little granddaughter. We should not have draconian threats hanging over our doctors. We should work to encourage more doctors to come to New Hampshire and do their life-saving work. And please, join with me to pass House Bill 224 so that more grandfathers and grandmothers can bounce a little baby on their knee. Thank you.
Thank you very much for your testimony, Representative. Are there any questions from the committee? Senator Whitley.
Thank you, Madam Chair, and thank you for taking my question. I know it's been a busy day for the House. I'm wondering if you're aware of any other medical procedure that carries criminal penalties in New Hampshire.
To the best of my research and the doctor's research, there is nothing other than this bill that carries criminal penalties.
Thank you.
Are there any further questions from the committee? Seeing none. Thank you very much, Representative. Before we continue on, there's a couple things that I would like to talk a little bit about before we start hearing testimony. As you know, there are a lot of people here that want to testify today. So what I'm going to ask from all of you is a few things. First of all, please, if you have written testimony, do not read your written testimony. We are not going to be voting on this bill today. I want to make sure that the committee members all have an opportunity to read and look over and ask questions about anything that you're going to give us today. So that being said, I would ask you, please do not repeat testimony that we've already heard. And in order for everyone to be heard, I'm going to allow each individual 3 minutes to testify in front of us. I will have my Apple phone. We all are on the same time now. So that way everyone will have 3 minutes to express their views on the bill. I would also ask you, please do not clap for an individual who's testifying. Don't cheer. Do not boo or hiss or anything like that. If you do that, I will ask for you to be removed from the room. We are extremely respectful of everyone who comes here, and we want to make sure that everyone who testifies, no matter what side of an issue that they're on, feels comfortable and to be able to talk to us about how they feel. So that being said, I'm going to call Representative Kutab and Representative Lynn. Just so you know, we do have an order here in which we call individuals. We will call up the representatives and then any senators that are here that will go first. And then we'll start working through the list. And we have 8 pages full of individuals who would like to speak. So thank you. And good afternoon, representatives. Thank you for being here. I know that you are supposed to be upstairs. So let's get you going on 3 minutes.
Thank you for having me here today, Senators. I'm Representative Caitlin Kutab from Rockingham District 17. I want to first point out that there is nothing in the law preventing babies from being delivered early as an alternative. So there is no reason why it would ever be medically necessary in an emergency for a baby to be aborted. Further, these procedures are multiple day procedures. It's not possible to just abort a baby in an emergency in a couple of hours. One of the most concerning parts for me about the repeal of this is that there has been some misinformation saying that third trimester abortion doesn't happen electively. I want to make very clear that that is misinformation. You can go down to Washington, D.C., and for any reason, you can have an abortion through 31 weeks, 6 days. In Maryland, you can go over to the care clinic and you can get an abortion through 35 weeks and 6 days. In Colorado, you can go to the Boulder Abortion Clinic literally until the day before birth to have an abortion for any reason. We are talking viable, healthy babies with no medical reason to abort them right up until birth. We already have inside of our law an exclusion saying that if the baby has a fatal fetal anomaly, abortion is legal. So this literally is viable, healthy babies. And with this in mind, I'm curious if those who were in favor of it would still be in favor of it if they knew that it does happen and that it is aborting viable, healthy babies. Thank you.
Hi, I'm Representative Bob Lynn, also from Wyndham, and I appear here in opposition to this bill. I guess I want to say at the outset that if you were to ask me, I would proudly tell you that I'm a pro-choice person. But like I believe most pro-choice people, I don't believe that means that abortion should be legal up until the moment of birth. Dealing specifically with the issue of the criminal penalties, I think it's really important to understand that what the proponents of this bill are asking for is a special rule for doctors. They want to have a special rule that says, even if you knowingly violate the law, and understand, it's really important to focus on the specific terms of the statute. In order for a doctor to be convicted of a criminal offense, it says any healthcare provider who knowingly performs or induces an abortion in violation of this subdivision, and remember, this subdivision has exceptions for fatal fetal abnormalities or for the life or serious health consequences to the mother, and knows that the fetus has a gestational age of of at least 24 weeks, or consciously disregards a substantial risk that the fetus's gestational age is 24 weeks. That latter section is designed in the law. There's a well-recognized legal principle of willful blindness in the law. It applies in a whole bunch of contexts. This captures that. It basically says that if it's obvious that the fetus is 24 weeks or more, and the doctor can't sort of say, I closed my eyes and didn't do what needed to be done to discover what was obvious. If that were the case, the doctor could still be convicted. So I think two things that are raised by the medical community that I think I can address very quickly. The first one is, as Representative Kutab pointed out, the first argument is this never happens. There are no post 24-week abortions that are performed in violation of the statute. It only happens when there's a fatal fetal abnormality or the life or health of the mother is in jeopardy. So the short answer to that, if that is really true, the short answer is, okay, so what's the problem? We passed this bill and nobody will ever be prosecuted because there's nothing that violates there's no conduct that violates the statute. I think, as Representative Kutab points out, in actuality, sometimes, it's unfortunate, but sometimes doctors do violate the law. A classic example of that is there are some doctors who are drug dealers. They have a license to prescribe drugs, and they, in fact, are running drug drug distribution factories. I can remember, which goes way back to 1978, when I first came to New Hampshire. One of the first cases I worked on was a doctor in Plastow who literally was responsible for, I believe it was about 0.75% of all the amphetamines distributed in the United States was distributed by that doctor's practice. So that happened, and that continues to happen today. So doctors do sometimes violate the law. The other, and I would concede a more substantial argument by doctors is, as Representative Wolf pointed out, there can be complicated cases. Sometimes it may be a difficult decision for a doctor to make about whether to proceed or not. And of course that happens, and nobody's suggesting it doesn't happen. But the requirement of knowing violation of the law protects the doctors in that circumstance. And I would ask you to think about this in other contexts. Lawyers also are often in situations where they have a tough decision to make about whether something is proper or not, whether something is truthful or not, that kind of thing. And more importantly, police officers, who generally have far less training than doctors and are paid far less than doctors, they often have to make split-second decisions. But the law is not that if they knowingly violate the law, they're not subject to prosecution. Of course they are, and they should be. So should doctors. So I respectfully ask you to vote ITL on this bill. Thank you. I'm happy to answer any questions.
Thank you very much, the both of you, for your testimony. Are there any questions from the committee? Senator Abbas.
Thank you, Madam Chair, and thank you for taking my question. Can you explain the practical effect of repealing the penalty, how that would impact this law?
Well, it would take away, a big disincentive to violate the law. But if you take away the criminal and civil penalties, now it's true. I don't disagree with Representative Wolf that it's true that there would still, at least theoretically, be in medical board sanctions, that kind of thing. But would we say, again, I draw the analogy to would we say that, look, if a police officer, uses excessive force and kills someone, and knowingly kills someone, well, we don't have to worry about that because the police officer will get fired from his job. Would we say that's enough of a sanction? I would submit we would not. We'd say, wait a minute, if you're a police officer and you kill someone, you're no different than anybody else. You get treated as the law requires, and I think that's what should happen with a doctor.
Are there any further questions? Seeing none, thank you very much for your testimony
Thank you.
this afternoon. The chair will call Representative Matthew Simon. Is he here? Okay.
Thank you, Madam Chair, members of the Senate Judiciary Committee. For the record, my name is Representative Matt Simon, and I represent Grafton District 1, Littleton, Lisbon, Lyman, Sugar Hill, Bath, and Monroe. I'm here to speak in opposition to HB 224. I will echo the sentiments of the previous speakers. Obviously, I don't want to go over all of the same ground. You have a lot of work ahead of you today. I would like to address the idea of maternity deserts as they've been popping up in the state of New Hampshire, though, because a great deal of the testimony in the House pertained to that, and I feel like a great deal of the testimony today was around that as well. My concern with the line of argument is that although the Fetal Life Protection Act only went into effect last year, maternal deserts have been popping up for the last 10 to 12 years, primarily due to the fact that people in the state of New Hampshire just aren't having enough children to keep them financially viable. All of the research I was able to do indicated that. So I'm unsure about how making abortions late in the pregnancy more available would help with the problem that not enough kids are being born in the state of New Hampshire. So I'd quickly like to just address that. Secondly, I would just like to remind the committee that at this particular point in time, the only children that we're talking about when it comes to the Fetal Life Protection Act are healthy children in healthy pregnancies with healthy mothers at a point in their development where they can live outside of the womb. And as the previous speaker said, there is the knowing and intentional clause in there as well. And I've asked the question several times. I haven't received an answer yet. In what circumstances, when the mother is healthy, the pregnancy is healthy, the child is healthy, would you need to intentionally and knowingly go in and kill the child before extracting it from the mother? On top of that, as far as the civil and criminal penalties are concerned, obviously, typical death related laws do not apply to us before birth unless we make it that way. And even, I would say, in agreement with Roe versus Wade, which gave us the authority to do this, that if a child were to be killed at the same point of gestation outside of the womb because they had already been born, and there are civil and criminal penalties for that, the same should hold true for that same child if it's simply on the other side of the mother's womb. Out of respect for the committee's time, I'll end my testimony with that.
Thank you very much, Representative. Are there any questions from the committee? Seeing none, thank you.
Thank you very much.
The chair will call Senator Prentice.
Good afternoon, Senator Carson, Chair Carson, and members of the Senate Judiciary Committee. For the record, my name is Sue Prentice. I'm the state senator from District 5, representing 15 communities in Larger Grafton, part of Sullivan, and one in Merrimack County. And District 5 is the home to Dartmouth Health and Dartmouth Hitchcock Medical Center. And what we know about Dartmouth Health and Dartmouth Hitchcock Medical Center is they not only serve the Upper Valley, but they serve mothers, families, mothers and families throughout the state of New Hampshire and the region. So I'm here before you today in support of repealing the criminal and the civil penalties. I'm a co-sponsor of this bill and have been working with Representative Wolf to bring this conversation forward and hopefully ensure its passage, as has happened in the House. Some, in respect to what Senator Carson said about not reading testimony or repeating anything, some of which Representative Wolf has said, but here's what I would like to offer to you, that there is a shrinking population of obstetrical care providers in the state. We have 26 acute care facilities. There are acute care and critical access hospitals in this state, but right now, in the last 20 years, we've seen 11 of those institutions, 11 of those hospitals actually close their maternity care units. So back in my day when I was the chief of emergency medical services, part of my job when we started to see this closure of units, and it was mostly in rural areas, was to go in with nurse midwives and obstetricians and train the emergency department staff and the ambulance staffs for managing these cases where there were large gaps in access to maternity care. We don't call it maternity deserts anymore. It's actually access to maternity care. So we went into these areas and worked with these folks. And at that time, I thought this was a rural problem. And most of my work had been done in rural parts of New Hampshire. Not the case anymore. The last two closures, Parkland Medical Center in Derry and Frisbee over in Rochester. So this is a statewide problem, not just a rural problem. Secondly, I want to point out, and I know that Representative Wolf has talked about this, we know that there is an obstetrical care residency program in the state, and I believe Dr. Ilana Koss is here today who can speak more to that. But this is our pipeline for obstetrical care providers. We want them to come to New Hampshire and to stay in New Hampshire. And these threats hanging over their head are going to make them think twice about whether they're going to practice here or not. So our ability to attract young families and keep them in this state is related to whether we repeal this or not, I believe. This is the only medical specialty where there are criminal penalties hanging over, a provider's head. Okay, so that is something I think needs its distinction. The second piece is that there is a licensure, there is a process to suspend and revoke licenses for medical care providers in the state. And that, as Representative Wolf said, is a really harsh penalty because it is your career, it is your livelihood, and it is what you've been trained to do. So again, I stand in support of this. Thank you for your time. I'd be happy to answer any questions that you have.
Thank you very much, Senator. Are there any questions from the committee? Senator Abbas.
Thank you, Madam Chair, and thank you for taking my question. You mentioned Parkland Medical in your testimony. Did they close their labor and delivery division because of the Fetal Life Protection Act?
They closed it before this happened. So we have a pre-existing situation that will only be exacerbated by this. That's my position.
Follow-up?
Yes, and thank you, Madam Chair. And with the understanding that HB 224 would repeal any criminal or civil penalty, would you be in support of any type of reduction of the penalty as opposed to a complete repeal? And if so, what would you ask that to look like?
I haven't contemplated that thoroughly, so it wouldn't be fair for me to answer at this time. But what I will state again is that a license to practice being the penalty, being revoked, being suspended or revoked, however that gets structured, is that's a penalty in itself. That is the end. That's career ending.
Follow-up?
Thank you.
Okay. Are there any further questions? Seeing none, thank you very much, Senator.
Thank you, Senator Carson.
Okay, we have a couple of individuals that because of time constraints of employment, they've asked to come forward, and we usually honor that. They are still going to be constrained to the rules. Don't repeat what we've heard, don't read testimony, and you have 3 minutes. So the first person I'm going to call is Dr. Albushis. Is she here? No, it's okay. I was just concentrating on writing something, and then it rang, and I just went like this. Good afternoon, doctor. I just want to remind you, there's some ground rules here. As you know, there's a lot of people here, and I know you were outside, you probably didn't hear. We've asked that you not repeat testimony that we've already heard. If you have written testimony, please don't read it, just try to paraphrase it, and everyone is going to be allotted 3 minutes. So when you're ready, just let me know and I'll get the timer started.
I'll try to paraphrase it, but I need to read it to stay within the time limit, if that's okay. I'm ready.
Please.
I'm here today to support HB 224. Repealing the criminal penalties from the Fetal Life Protection Act is imperative to the safety of pregnant patients in our state, in addition to being able to sustain a workforce of capable, passionate obstetricians. My name's Dr. Danielle Albushis. I'm an OBGYN who's been practicing since 2003 here in New Hampshire. It was so important that we as physicians and patient storytellers work to amend the Fetal Life Protection Act so that there are exceptions for fatal fetal anomalies. I'm thankful to all the Senate and House members who made this a reality. What I hope that physicians like myself have made clear in testifying for such issues is that pregnancy is complex and maternal conditions are becoming more high risk. Therefore, there's danger to patients when linking laws that try to define clinical scenarios to criminal penalties. Let's discuss a few clinical scenarios. For example, when there's a pregnant patient who's bleeding from her uterus at any given gestational age, obstetricians make decisions that protect the health of the mother and respect the desired chance of survival for the fetus. We're used to making these decisions with our patients and with experts in the field. When there is a potential that we would be charged with a felony, there will be delays in the care of that mother. She will bleed more than necessary. She may develop a critical condition where blood products are no longer effective. She will be infected longer than she should be, and the scenarios can go on and on. Criminal penalties are not insignificant. Even if it was determined that we took proper care of the patient, this process would likely end our careers. Criminal penalties are not necessary when we have a system of checks and balances through the Board of Medicine. Physicians are accountable for any decisions that break the law through the Board of Medicine. The shortages of obstetricians and healthcare workers in low and high-risk obstetrics is real in New Hampshire. When I first started working here in 2003, there were 23 hospitals that delivered babies. Now there are 15, and likely soon to be 13. Hospital labor and delivery units are closing, in large part because there's not the staff to keep a unit open 24/7. 14% of obstetricians are less than 40 years old, leading to a future critical shortage of obstetric care providers. It will be harder for New Hampshire to recruit obstetricians when they know there are criminal penalties associated with complex decisions they will need to make while working here. I've been recruiting young obstetrician gynecologists to the area, and these details are important to them. Please allow us to do our job to provide compassionate, up-to-date care directly to our patients without having to be in fear of criminal penalties, so pregnant patients have the best chance of having the best outcomes possible. Thank you for your time.
Thank you very much, Dr. Albush. Are there any questions? Senator Whitley.
Thank you, Madam Chair. Thank you for taking my question. So when looking at the language of the criminal penalties, and if you don't have it in front of you, it says any healthcare provider who knowingly performs or induces an abortion in violation of this subdivision and knows that the fetus has a gestational age of at least 24 weeks or consciously disregards a substantial risk that the fetus has a gestational age. So I want to draw your attention to that language, or consciously disregards a substantial risk. And the reason why I raise this is the emergency situations that you address. Sometimes because pregnancy, and I know personally, pregnancy is just unpredictable, right? And anything can happen at any time. And every minute, every second, when you're dealing with a pregnancy can be precarious for both the baby and the mother. So I'm wondering if, you have concerns about like the impact of a practice in an emergency situation where there's a threat of, criminal penalties if someone, quote, consciously disregards a substantial risk of.
Yes, the problem is in the delay of the care as we process. It's not just processing the complex clinical scenarios between us and the patient, or also the time it takes to maybe get experts involved to help us with those decisions, but to also overlay our fear or concern about a criminal penalty is that delay in the care of the patient that is real in those scenarios.
Follow-up?
Yes.
And would, as a doctor, not a lawyer, would you, be able to define what it means to consciously disregard?
And I think that language is challenging to us and vague, and initially we're just trying to take care of the patient, not trying to translate legal jargon that would again delay the care to the patient.
Thank you.
Thank you.
Are there any further questions? Seeing none, thank you very much
Thank
for your
you.
testimony. The chair is going to call Dr. Cass along with our former colleague, Senator Hood.
Thank you, Madam Chair, members of the committee. I will not add to the time, but I wanted to be present in case there were questions that I could help answer, and I appreciate your.
For allowing me to testify today in support of HB 224. And I will, again, without hitting some of the highlights of my prior colleagues, I really just want to come before you today and urge you to let physicians care for patients free from any concern or fear about the criminal penalties and the legal implications of doing so. MDs really are uniquely trained and should be able to focus on the medical issues, as my colleague has just illustrated with some real life examples, in a dynamic situation that can evolve literally minute by minute. That physician and provider should really be emphasizing the best care, bringing evidence and their clinical expertise into that room when trying to provide care for a pregnant woman, so that is the emphasis of their of what that provider is trying to do, without the fear of repercussions and having to view things always through that lens as they try to navigate this incredibly dire circumstance for a pregnant individual. As the chair of obstetrics and gynecology at Dartmouth-Hitchcock, the only residency training program in the state of New Hampshire, I want to remind you about the implications of this legislation and the importance of withdrawing the criminal penalties. We know from the literature that more than half of the residents we train, again, at Dartmouth-Hitchcock, will stay in their community in the region of New Hampshire and serve the women of the Granite State. Furthermore, we know that the implications are not just for our medical residents, but also for the medical students as the only medical school in the state of New Hampshire. And this will have implications for our nurses, our licensed nurse assistants. So literally the ripple effect of care is so far reaching. All of these individuals will be equipped and trained to then go out into practice. And we know from the trends that many of these people will choose to stay and care for the women and families in the state of New Hampshire. I find myself currently in the position having to recruit 2 maternal fetal medicine specialists. These are OBGYN doctors who are additionally trained and have expertise in high-risk pregnancies. We have 7 such individuals that I am aware of in the state of New Hampshire. And as I've shared with you before, 4 of those people are scheduled to retire in the next year and a half. This is an issue that colors the conversation and has an impact on my recruiting, not just for these high-risk providers with the numbers that I've shared with you, but working in a tertiary care center like Dartmouth-Hitchcock, for my providers who care for patients when they're pregnant and have cancer, the conversations that will arise in trauma, in the emergency room, always through the lens of taking the best care of the patient. I'm happy to take any questions.
Thank you very much for your testimony this afternoon. Are there any questions from the committee? Senator Whitley?
Thank you, Madam Chair. Thank you for taking my question. I appreciate you coming down to share that startling statistic about maternal fetal specialists. Those are, of course, our highest risk moms, that are going to need potentially that emergency care. Have you heard from folks that are contemplating coming to New Hampshire and, debate it, including in their consideration these criminal penalties? Have you heard from potential residents that this is an issue that they are contemplating?
So I would say that we certainly have seen and heard. We've just gone through the match actually last month, which is when medical students that are put in their list of programs they want to go to, and then they're sort of ranked. And we just saw the positive effect of the state of New Hampshire continuing to allow safe abortions in our state, and we had a record number of applicants, and we matched very well, and we saw candidates vote with their feet, quite literally, coming to a state like New Hampshire, which does allow abortion in the binary world that we tragically find ourselves now operating. Do you allow abortion, yes or no, ban state or not? With respect to your specific question, I absolutely see this having an impact, again, not just on my maternal fetal medicine specialists, but also on pediatrics, other realms of care, including oncology providers, cancer providers, who we know will be taking care of a certain percentage of patients of reproductive age, some of whom will find themselves pregnant. And how will we navigate the waters of these conversations? Again, always through the lens we should be prioritizing, which is the best care for the patient, allowing her and her partner to have choices, unencumbered by the criminal implications that can literally limit the ability for that provider to offer the best care for that woman and her family.
Thank you.
Are there any further questions? Seeing none, thank you both.
Thank you.
Okay, next the chair will call the Honorable Joan Espinola. Good afternoon.
Thank you. Madam Chairman and Senators, I am opposed to House Bill 224, and I want to speak on that issue. I have a fetal model here that is of a 24-week-old baby in the womb. And I thought that it was a good thing to bring so that we could actually see what we're talking about. And I think if you pass House Bill 224, you would mortally wound the Fetal Life Protection Act, and no one will take seriously a law that doesn't have penalties for transgressing it. Since this law has gone into effect, does anyone know whether anyone has been, any doctor has been prosecuted by the Fetal Life Protection Act? I don't know of anything in the news about that. So some people are saying that they don't need penalties because the abortionists in New Hampshire don't do late-term abortions. But how do we know this? The Abortion Statistic Act was repealed, and we don't even know how many abortions are done in New Hampshire, let alone at what gestation. And if New Hampshire abortionists don't do abortions after 24 weeks, why is there an outcry to repeal the penalties? Could it be there is a late-term abortionist waiting to come into New Hampshire? Could it be that there's already abortions being done in New Hampshire? And isn't 6 months a long time, really, to wait to say that you want to have an abortion? And it's bad enough when one person does evil, but when the government condones evil, perpetuating the intrinsic evil of abortion, it corrupts our legal system. I see bumper stickers on cars and hear people saying, "God bless America." Like the Israelites in the Old Testament, America has distanced itself from God and the Ten Commandments, especially the commandment, "Thou shalt not kill." Why should a good God bless a country that pays no heed to him? If you vote for this bill, you're saying it's okay to kill a baby that can survive outside the womb. That's infanticide. If you vote or to pass on this bill, we know more babies will die. If this bill passes, you will have innocent blood on your hands. America is materially rich, but morally bankrupt. You have a chance to start changing that with your vote on House Bill 224. And I respectfully ask you to vote against House Bill 224. Thank you. And if anybody has any questions, I'd gladly answer them.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much.
Thank you. And I have testimony to give to the committee.
Thank you. The chair will call Bob Dunn. I think you hit the button and it turned off. There we go.
Thank you, Madam Chair, members of the committee. Good afternoon. I'm Bob Dunn, the Director of the Office of Public Policy for the Roman Catholic Diocese of Manchester, and I'm here today on behalf of Bishop Peter Labashi to respectfully register our opposition to HB 224. Representative Simon, Representative Katab, and especially former Chief Justice Lynn, speaking from the pro-choice perspective, really hit the nail on the head in terms of the problems with this bill. I would just like to add a couple of quick comments. First off, in what other circumstance would we be sitting here talking about repealing the criminal and civil penalties that pertain to the killing of one particular category of human being, especially where the person that has violated the law in question has done so by acting knowingly or with conscious disregard? It wouldn't be happening. As I have said to this committee before, so I hope you'll bear with me if I say it again, it only stands to reason that if we want our society to respect and value the dignity and the life of a young human being who's a refugee, or the young human being who is homeless, or the young human being who does not have access to health care, then we need to value and respect the life and the dignity of the young human being in the womb as well. In the end, if we ask society to treat certain ones of us as expendable, we can't be surprised if society treats certain ones of us as expendable. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much. Okay. Okay, the chair will call Fidelma McKenna. I think it's a McKenna. Is there a person named McKenna? Last name McKenna? Okay.
Can you guys hear me okay?
Yes, did you hear what we're doing today about not reading testimony? Don't repeat what we've already heard, and you have 3 minutes.
Okay, no, don't read the testimony.
Can you paraphrase it? And if you can, email it to our aide Matthew, and we will all get a copy of it. We're not going to vote on this bill today.
Sure. Good afternoon. My name is Fidelma McKenna, and I'm a certified nurse midwife. I work in southern New Hampshire, and I'm sorry because I'm very nervous, and now that I can't read, I'm a little flustered. But I think my point was that we have made it through COVID. We have stayed up all night with patients. We've pressed on painful backs. We have wept. We have wiped away tears that are being wept. And we have worked so hard to care for our patients, and we are worn down. So please consider the impact that removing the idea that we are criminals could have on our emotional work. We have been trained. We are sorry about that. We've been expertly trained. We are passionate and we are committed, and we know exactly what to do in moments to take care of people in their reproductive and sexual health. And we only want to do what is best for the patient and what makes sense for their emotional, physical, and psychological health. We are expertly trained and we know what to do. Please let us do it, and don't put us at risk of being seen as villains by criminalizing our work. This is evidence-based care that is the standard for people's lives in sexual and reproductive health. And it's so scary to think that we could be seen by people as criminals, as felons, when we're just trying to take care of people. Thank you very much.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much. The chair will call Courtney Reed. Courtney Reed. Courtney Reed. Thank you, Ms. Reed. Since you're outside, I'll just repeat this. We're asking if you have testimony, please do not read it. We're interested in hearing new testimony, so please don't repeat. And you have 3 minutes.
Okay, thank you so
Okay?
much. Thank you. Yeah, thank you so much, Chair Carson and members of the committee. My name is Courtney Reed. I'm here with the ACLU New Hampshire to speak in support of HB 224, a bill that would repeal the criminal and civil penalties from New Hampshire's current abortion ban, under which presently providers are at risk of facing a Class B felony, which could prompt fines of up to $100,000 or jail time of 3.5 to up to 7 years for providing reproductive care. And what this bill does is it singles out providers capable of performing abortions later in pregnancy, while there's no other medical procedure in the state that has been criminalized. So I was hoping that we could look at some research together. Along with an ACLU fact sheet, I've passed out research from the British Medical Journal of Global Health that highlights some of the negative public health outcomes related to criminalizing abortion. And it's highlighted for you, but I'll just go over a little bit of the findings from that. And it's that criminalization negatively impacts public health. It negatively impacts the relationship between providers and patients. It leads to a hesitancy in providing care, and it causes increased maternal mortality and morbidity. And it also has implications for access to safe abortion. And we've heard this from the provider community. We've heard it from other testimony today. When the abortion ban was put in place in 2021, that providers had a fear that they wouldn't be able to offer care. And it can leave providers feeling cornered in situations where they might have to delay care or wait for a continued deterioration of health before a patient can fit into the limited exceptions under New Hampshire's current state law. I'm advocating for legislators to effect policy that attracts healthcare providers to the Granite State rather than inspiring fear that they cannot provide adequate care through these criminalizations. And I'd like to note that our current law is a slippery slope for further government interference aimed to limit access to abortion and is an invitation for further harassment against medical professionals. And for these reasons, I'd like to encourage members of the committee to vote OTP on this bill. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much, Ms. Reed. Okay, the chair is going to call Jake Berry. Nope, not in here. Could you check outside, please? I know. Mr. Berry, oh, you dropped some things. Okay. Just so you know, we're trying to make sure everyone has an opportunity to speak.
Of course.
So please, if you have written testimony, paraphrase it.
Yes.
We're not execing this today, so we're going to have time to read through it. Please don't repeat what we've already heard, and you have 3 minutes.
I will be very brief. Thank you, Madam Chair. Good afternoon. My name is Jake Berry. I'm the Vice President of Policy at New Futures. As many of you know, New Futures is a nonpartisan, nonprofit health policy and advocacy organization. We work with healthcare providers, families, and policymakers like yourselves to ensure access to quality, affordable healthcare all across the Granite State. I don't want to repeat too much of what's been said today, but I do want to emphasize New Futures' strong support both for this bill and for House Bill 224, which you'll hear later today. Simply put, reproductive care, including abortion, is a critical element of overall health care. Access to abortion directly impacts the current health and future well-being of our women, our children, and our families. As you've heard, women who give birth after being unable to access abortion report more life-threatening complications like eclampsia and postpartum hemorrhage. They report chronic conditions like headache and migraines and joint pain, gestational hypertension. Women who are denied abortion are less likely to have the money they need to cover basic living expenses like food, housing, and transportation. And children who are born as a result of not being able to access abortion are more likely to live below the federal poverty line. Adverse childhood experiences like poverty are known to negatively impact brain development and can follow children all throughout their lives. In summary, abortion is a needed part of healthcare. No doctor or medical professional should be fined or penalized for providing these needed medical procedures. And it's critical that women be able to access abortion to support their own health and the health of their families. For these reasons, we ask that you support both HB 88 and 224 and vote them both ought to pass. And I'm happy to take questions.
Thank you very much, Mr. Berry. Are there any questions from the committee? Senator Abbas.
Thank you, Madam Chair, and thank you for taking my question. Sure. Since the Fetal Life Protection Act was signed into law, do you have any documented circumstances where someone was in New Hampshire was denied access to an abortion?
I should say we at New Future, we're not a service provider. We don't have direct access to patients in that way. I'm sure that there are others who will be testifying before you this afternoon who may have more to say about that.
Follow-up?
Thank you, Madam Chair. Are you aware of it? Have you heard of, or are you aware of any circumstances?
Not necessarily, but I wouldn't necessarily be aware.
Thank you.
Thank you.
Are there any further questions? Seeing none. Thank you very much, Mr. Barrett.
Thank you very much.
The chair will call Maris Toland.
Hello, good afternoon.
Hi, good afternoon. Since you were outside, what we're doing, because we want everybody to have an opportunity to speak, if you have written testimony, please don't read it. Please try not to repeat testimony we've already heard, and everyone is getting 3 minutes.
Okay,
Okay?
thank you.
So please begin.
My name is Dr. Maris Toland. I'm a resident physician up in Dartmouth, specializing in OBGYN. I'm here on behalf of myself. I'm here to support House Bill 224, which repeals criminal penalties for physicians. I think it's really challenging precedent to have legal penalties interfering with medical decision-making that should be between a provider and a patient. And I think I'd just like to tell you a couple of possible scenarios about things that we see. Just as a reminder, the number of situations that fall into the category of this legislation is very, very slim, but often very serious. Some of the types of situations that can happen that would potentially delay care for patients by worrying physicians whether or not they're going to be faced with legal charges could be a pregnant patient who comes in over 24 weeks pregnant, say 25, 26 weeks, who's broken their water early, didn't know about it, and has gone into septic shock from an infection. Sometimes that can happen and still have a heartbeat, but be drastically dangerous for the life of the mother and require quick intervention. Not being able to provide active, immediate care for that patient could delay their care, which can be emotionally traumatizing and sometimes lead to a patient's death if it's severe enough. Another scenario could be if a patient has a placental dysfunction, which has a abnormality that could result in severe hemorrhage. If that patient goes into labor early and the fetus is in that periviable window, the patient could die and the fetus could have very, very low chance of surviving. It's more safe for the mother to be able to act immediately. Delays in that care that could be caused by even just the fear of legislation could be traumatizing and potentially lead to severe morbidity or mortality for those patients. The last thing I'd say is just, there's too many scenarios to think about and to tell you about today, but I would encourage you to listen to This American Life podcast. It's number 792, I believe, called When to Leave. And it's a testimony essentially from an OBGYN provider in Idaho, where significant restrictions have been passed that limit the ability for OBGYNs to take care of their patients. And that applies to some different things, but the bottom line is that even the fear of legislation or the misunderstanding of the current bills can lead to significant delays in care that are dangerous for our patients. The other thing that it does is it makes it very hard to recruit physicians to the state. And so I encourage you to listen to that to get a perspective on what's happening in other states that are passing legislations with criminal penalties. Thank you.
Thank you very much for your testimony. Are there any questions for the committee?
Thank you very much.
Seeing none, thank you. The chair will call Laura El Alzim.
Good afternoon. Thanks for having us here. My name is Laura Elazim. Our best wishes to Senator Gannon. I came to talk about the healthy, viable babies that are affected by a change in the Fetal Life Protection Act. They are wanted desperately, and that was really the point of my testimony. I'm a mother of 4 adopted children. My testimony happened to have been about surrogacy, but these children are wanted worldwide. And I've submitted that testimony, so I'm just going to pivot away from that for a moment. The only other point I want to make is what I keep hearing over and over again is that we're discouraging doctors from coming to New Hampshire because of these penalties. And if we are discouraging from coming to New Hampshire the kind of doctors who are comfortable killing 24-week developed, healthy, viable babies, then who pose, by the way, no threat to the mother. So those instances that we just heard about don't fall in this category. Doctors who are comfortable killing these babies, I think we might be better off without them. And it may be a good idea to instead embark on a very rigorous campaign to tell doctors about how awesome New Hampshire is and try to go and recruit the sort of doctors who would be appalled at the very notion of killing helpless, innocent humans. That might be a better tack to go on. So that's my opinion, and I hope that you will oppose both of the bills that are before you today and preserve the Fetal Life Protection Act and those 6-month-plus developed babies. Any questions?
Thank you for your testimony, Mrs. Alzim. I always mispronounce.
Alazim, that's okay.
Are there any questions from the committee? Seeing none, thank you very much for your testimony. The chair will call Beth Scare. I think that's how it's pronounced.
Hi, thanks for taking my testimony. My name is Beth Scare. I'm a mother from Nashua, and I'm here to speak today in defense of the New Hampshire's Fetal Life Protection Act. When I read the Union Leader, I often read heartwarming stories of people rescuing ducklings, bear cubs, puppies, kittens, all manner of creatures. And if you go on YouTube, you'll find endless sweet videos about shelter dogs being rescued and cats rescued from the streets. And this is your chance to save innocent lives. Your vote to ITL HB 224 is a vote to save healthy, viable babies just a few weeks from being born, from being killed in abortions. And I want to, as far as the arguments go against this bill, I want to remind those of you who were around a few years ago, you may have heard similar excuses in opposition to our fetal homicide law. There was big, huge opposition to that. And the reason being that our fetal homicide law says that if a baby is killed before it's born, that the perpetrator can be charged with murder. And this proves the humanity of the unborn child. And I have brought pictures of a 23-week abortion procedure so you can see the reality of it. Abortion workers, many of them have said that they felt suicidal after participating in these procedures. So please think of them when you vote on this bill. And of course, the mom, can you imagine the horror of the mom going through this? Also, I want to point out that Dr. Cass hid her ulterior motive. She talked about her students. The Dartmouth has the Ryan Residency Training Program, which trains OBGYN students in all types of abortion, including late-term abortion, and it also teaches pro-abortion political advocacy. The Ryan Residency Training Program is based out of the University of California, San Francisco, which has been performing horrific fetal tissue research, including creating humanized mice. And there's a Ryan Residency Training Program at the University of Pittsburgh, where David DeLayden released a video about ghoulish experiments being performed on late-term aborted babies at the University of Pittsburgh. So I'm suspicious of what their real concern is. I think they see the bottom line here, that they might lose their training program, or maybe it's already being scaled back and they want to restore it. So please vote ITL on HB 224 and protect these babies. Thanks.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you. The chair is going to call Ben Safford and Lori Safford. Mr. Bossy, could you move the chair out of the way for Mr. Safford? Thank you.
Thank you very much. You can hear me okay?
We can hear you
All right.
fine, Mr. Safford.
Thank you so much for that. My name is Ben Safford, Madam Chair and Judiciary Committee members. I live in Pelham. Thank you, Senator Abbas. You're my senator. My brother and I have Duchenne muscular dystrophy, a fatal muscle wasting disease with no cure. Under our current Fetal Life Protection Act, Sam and I could be aborted up until birth because we have a fatal fetal anomaly. We are here to ask you to oppose HB 224, which would allow even healthy infants to be aborted through the 9th month of pregnancy. There are several basic types of abortion which can be used in the 1st and 2nd trimesters. First, there are chemical abortion pills, which inhibit pregnancy hormones. There is also suction type abortion, where the unborn child is literally vacuumed like dirt from the mother's womb. Third, there is curate type abortion, where the baby is cut from the mother's womb with a spoon-like object. Another type is like a cesarean section, where the baby is surgically removed from the mother and allowed to suffocate because the child's lungs aren't developed. But we are here discussing late-term abortion in the 7th, 8th, and 9th month of pregnancy. These are especially egregious. The salt brine technique, where the baby is literally pickled to death by injection of a strong salt solution, is not done anymore because of the uncontrollable thrashing of the baby inside the mother's womb. So the abortionist needed a method that causes a faster death. Now they use an injection of digoxin into the baby's heart, which causes a heart attack. Then they induce labor and a dead baby is born. Before voting on this bill, I believe you should have an accurate picture of late-term abortion. It is an act of murder. It's a violation of the golden rule. It devalues human life. It often brings shame, heartache, and deep regret in the mother and the person doing it. And it involves the shedding of innocent blood. These 6 things doth the Lord hate. Yea, 7 are an abomination unto him. A proud look, a lying tongue, and hands that shed innocent blood, and heart that deviseth wicked imaginations, feet that be swift in running to mischief, a false witness that speaketh lies, and he that soweth discord among brethren. And I can see that this sows discord. Please vote ITL and spare these innocent children. Thank you. I am happy to answer any questions. By the way, I got most of my information from this website called abortionno.org or noabortion.org, and New Hampshire Right to Life has resources on the education of abortion. And that's where I got most of my information if you're going to ask that. Thank you.
Thank you very much for your testimony, Mr. Safford. Are there any questions? Seeing none, thank you. Ms. Safford, would you like to have some opportunity as well?
Yes, thank you. So I am the mom, grateful mom of 2 sons with Duchenne muscular dystrophy. As he mentioned, it is a fatal fetal anomaly. Ben and Sam are on the CFI waiver. And I just wanted to take this opportunity to thank Senator Whitley for her support of Bill Gannon's bill, SB 36, which would have made it easier for someone like me to keep their disabled loved ones at home. I was really disappointed in the lack of Republican support for this much-needed bill. With regards to HB 224, I'm just here to remind you that all life has value. You know, Ben and Sam have been the biggest blessings in my life. I have had a high-tech career for 17 years. I've traveled the world. I've done a lot of things. But being the mom of Ben and Sam and my daughter Lydia, I can't tell you, it has not been easy. My husband passed away 11 years ago. So I'm a single mom. It has not been easy, but the value in life, we're all born in the image of God, created in the image of God, and we all have value. Ben lived away at Gordon College. He has a social work degree. He works for a nonprofit that supports young adults with cognitive disability. My son Sam is an artist and writes music. He's a musician and a motivational speaker. They both volunteer at our church every week. And I guess I want to say that when we take away the struggle, that the struggle is what it creates strong people of character. And I think when we take away the struggle, we are raising a generation that has no consequences for their actions. I keep hearing that we are in a demographic winter here in New Hampshire. The children that are being born here are leaving our state once they're young adults. And the fact that doctors are not here, it has nothing to do with our Fetal Life Protection Act. We have pulmonologists, orthopedic surgeons, we have cardiologists, we have all kinds, neurologists, we have all kinds of medical care. And I can tell you that in Massachusetts and in New Hampshire, everybody is experiencing workforce shortage. It's not because of our Fetal Life Protection Act. And the aging is an issue as well. Our two primary caregivers at home are over 60. And we can't find young people to take these jobs. So lastly, I just want to say that eliminating the penalties is a political move that really renders the law useless. Repeal the law if you want to repeal the law, but would we ever eliminate penalties for arson or burglary or kidnapping or murder and leave a gutless bill on the books? It makes no sense. Please vote no on HB 224. Thank you.
Thank you very much for your testimony. Are there any questions? Seeing none, thank you very much. Okay, the chair is going to call Roy Dennehy. Let me know when you're ready to get started, Mr. Dennehy.
Okay, thank you. Thank you, Madam Chair, members of the committee. Roy Dennehy is my name, Life Director for the Knights of Columbus here in New Hampshire. I represent 7,000 Catholic men and their families, and our main mission is to perform many acts of charity throughout our state, including a tremendous amount of work that we provide for pregnancy care centers throughout New Hampshire. And my pastor at St. Matthew's Church in Windham asked me to read his statement that he could not be here today, and he asked me to read it to you as a committee. And Monsignor Anthony Frontero has worked in Rome as Vatican's representative to the United Nations. He has been the former pastor of the cathedral here in Manchester, New Hampshire. And this is what he asked me to say. As pastor of St. Matthew's Catholic Community in Windham, I reach out to you to convey my strong opposition to HB 224 and HB 88. I find it monstrous that a state legislator would even consider the barbaric practice of aborting children at any age of life, not to mention up to the very moment of birth. When you consider that New Hampshire legislature passed a law last week making it illegal to declaw a cat out of the sensitivity and pain of suffering such a procedure causes a home pet. I happen to agree with that legislation, by the way, he says. But how is it that we can enact such a law regarding feline friends and the next week enact a law that is completely indifferent to the pain and suffering of human person suffers in the earliest stages through the horror of abortion? We have become so far gone as a people that we don't see the depravity of such legislation. I implore you and your fellow legislators to oppose these two bills with every fiber of your being. As a representative of the people, I ask you to protect people, at the same time so heartlessly promote laws and policies which willfully destroy them and most innocent and vulnerable people, yet at the same time pass a law against declaring cats. There is something seriously wrong in our society and in our state when lawmakers cannot discern and act against this kind of depravity. I ask you to oppose these bills today, which threaten future generations of our citizens. It is a sick and sad commentary indeed when household pets enjoy more fundamental rights than human beings. Thank you very much.
Thank you very much for your testimony, Mr. Dennehy. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The chair is going to call Kathleen Guerin. Ms. Guerin, please let me know when you're ready.
I crossed out quite a bit. I'm trying not to repeat. My name is Kathleen Guerin, and I'm from Pelham, New Hampshire. I come here today for the first time. I always vote. I always follow things, and I'll send you my views, but I've never, ever come here until today. The reason I'm here today is because it's Holy Thursday. It's the day that our Savior, Jesus Christ, was betrayed, arrested, and condemned to death, though he was completely innocent and did no wrong. It is impossible to miss the similarity of what is taking place here in this room today, 2,000 years later, when we sit here and determine whether it is all right to let innocent babies live or die. It's hard to believe. And so I was forced to come. I would like to read a couple of thoughts from Mother Teresa that she gave at a breakfast at Washington, D.C. in 1997. The first quote, "What is taking place in America today is a war against the child. If we accept that a mother can kill her own child, how can we tell other people not to kill one another?" End of quote. It is a sad day as I listen to these talks from doctors who have been educated to heal people, and they speak of abortion and they only talk about one patient. There are two patients involved in this. As a mother, and as if any of you are parents, you know when there's a child in the womb, it is a child. Excuse me. But to completely ignore that they're existing, to completely ignore the suffering, the ripping to shreds of their bodies, the death that's taking place here, it's unconscionable. I don't understand how it's been come this long, and I can't believe that anyone wants to take away protection, especially for children that are ready to be born outside of the womb. I'm speaking from the heart. I'm sorry. The second quote, "Any country that accepts abortion is not teaching its people to love, but to use violence to get what it wants." Look at our country. Look at the violence. Do you have children? Do you have grandchildren? Are you at all concerned? We need to connect the dots here. We have stood in God's place and we have said it is all right to murder children. This is a fact. Are you worried when your children go to school? Are you worried when you go to church or if you go to support a pregnancy care center that someone's going to come at you because you're trying to help a woman who chooses life? Does that worry any of you? It worries me. There are alternatives to abortion today for women. I help people, other people help. I know many hundreds of people, thousands of people that help people, that will support them financially. There are places in place where they can go and live. I don't want to see women in cars. I don't want to see women having babies in the woods and things like that. No, and we put our money where our mouth is and we support these things that are right. I'm sorry, I've lost a little bit of my track here, but I just think we have to remember what we're here for, and this is so serious. And I would just ask that you remember what Mother Teresa also said at that prayer breakfast, that Jesus said, "Whatever you do to the least, you do to me." And she taught her sisters to look at their hands and to say, and remember when you're making a decision, and I ask you, when you're making your decision to vote on this today, with all due respect and love in my heart, to hear the words of Jesus, "You did it to me. Please, please vote against these two bills." Thank you. I appreciate you for listening for me.
Thank you very much for your testimony, Ms. Guerin. Are there any questions from the committee? Seeing none, thank you. The chair will call Brian Harlow. No, Brian Harlow. Okay. The chair will call Susan Gendron. Good afternoon, Ms. Gendron.
Good afternoon. Thank you, Madam Chair.
Could you make sure to speak into the microphone?
Thank
There
you,
we
Madam
go.
Chair and committee members. After hearing Kathleen, there's not much to be said. I just want to say that I'm opposed to HB 224, and I just feel that I'm opposed to repealing the civil and criminal penalties because the obvious consequence is passing HB 224 is going to allow abortion throughout pregnancy, including abortions of viable preborn children up to birth. It's just going to escalate. All of us are here because our mothers chose life. Every life has a purpose. Just think about your own life. How many people has your own life impacted, from your family to friends and even strangers? So too is the life of the unborn baby, a God-given life of purpose that will impact so many people. Thank you for your consideration.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much for your testimony, Ms. Gendron. The chair will call Paul Galasso. Good afternoon, Mr. Galasso. Let me know when you're ready.
Good afternoon. Let me just first say thank you for hearing my testimony to you this afternoon. I have one main message, and that message is when you do vote, please remember the babies. So much of our conversation is focused on the hospitals, the doctors, the lawyers, the pro-abortion industry. And these are all distractions from the truth surrounding abortion. I have been a volunteer at the Pennacook Pregnancy Center in Manchester for the past 7 years. I also did similar work in Houston. I've talked with many, many women. We offer choice to those women. We offer the choice, which is life, and then we provide support to them throughout their pregnancy. The circumstances that drive women to have abortions are varied, but the statistics based on the Guttmacher Institute, Mayo Clinic, and various psychology journals is clear. The number of abortions based on rape and incest, which is often used as a justification, is less than 0.5%. Those related to health matters is less than 2.5%. 97% of abortions today is a form of health care. And I'm not trying to diminish how difficult it is for women that have unplanned pregnancies. But the net effect of abortion has multiple victims. The baby at 9 weeks feels pain. The baby at 9 weeks has a heartbeat. It has eyes and a nose and lips, and it moves its limbs. It swims in its mom's amniotic fluid. Abortion is an issue for this country where we are one of 6 countries out of 193 countries around the world that allow abortion on demand. We have to be better than this. We're not like China. We're not like North Korea. We're not like Vietnam. We're Americans, and we became Americans because we believe in American values. Killing babies is not consistent with American values. So let me just close by pleading with you, when you go to vote, which I'm in strong opposition to, Bill 224, please remember the babies. Thank you very much.
Thank you very much for your testimony. Mr. Galasso. Are there any questions from the committee? Seeing none, thank you
Okay.
very much.
Thanks.
The chair will call Pamela Colantuno. Good afternoon, Ms. Colantuno.
Good afternoon. How are you?
Good. When you're ready, let me know.
Okay. I just have a couple of notes here. Um, Thank you for the opportunity to be heard regarding my opposing HB 224 on this day of April the 6th, 2023. Today is my youngest daughter's birthday, and I celebrate her life and her journey. She was 3 weeks early with a scheduled C-section at a healthy weight of 7 pounds, 2 ounces. This is her little T-shirt that she wore home from the hospital that day. So 7 pounds, 2 ounces. I save everything. I'm just that kind of person. And so she is 23 years old today, which I can't believe even that. We as a people have been battling this issue for some time, and I would suppose that everyone is quite tired of it, correct? I would suppose that would be true. Life in the womb, life outside of the womb, if we should allow abortion up to term. How far have we gone as a society and a culture that we would determine if a little person should live or die? The ladies in pink talk about this is my body and I should be able to do with it anything I choose. However, we are talking about a full living human being breathing. And we do jail people if we commit a crime of killing someone outside the womb. I want to say, don't be fooled. A woman knows her body well. And has personal responsibility for prevention, as most abortions are induced. I believe as women, we are smarter than that. And to my amazement, we have the tools and simple technology more than we know. 2 12-year-old girls introduced me to this technology, which is a simple app that would track your menstrual cycle. In fact, there are 50 downloads for any woman regarding what you can expect from your cycle, when you are fertile, when it's time to ovulate, and when it's time to make that love connection. The funny thing about these apps, it will even tell you when you can expect to be moody. The Flow Period Tracker has 1 million users. The Clue Period Tracker has 340,000 users. These are 2 out of 50 applications on your iPhone. It tracks your cycle, fertility, and ovulation. Women know their bodies, so don't be fooled. And I thank you that the choice is not to kill. And I thank you for your time and consideration as you vote on this bill. Thank you for your service.
Thank you very much for your testimony, Ms. Colantuno. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The chair will call Margaret Gibbons. Good afternoon, Ms. Gibbons.
Thank you, Madam Chair, Senators. This is my first time. I'm quite nervous with this. My name is Margaret Gibbons. I'm from Pelham, and I am opposed to HB 224 and HB 88. I would like to say that for almost 40 years, I have worked with children and adults with intellectual and developmental disabilities. And I would say, ask them if life is worth living. In their physical poverty, they've taught me more about the riches of life. And there's no dollar value that you can put on a person's life. They've taught me what it means to be human and to the giving and receiving of unconditional love and acceptance of who we are. We walk this journey of life together, carrying each other's burdens. They are our teachers. I have an adopted sister who is one of the most beautiful souls I have ever encountered in life. She is so loving and compassionate, joyful and funny. Yet, she was conceived through incest. By today's standards, she would have been considered an unfortunate accident and aborted without a second thought. But the world is a better place because she was born. She grew up in a loving home, got married, and she adopted 3 children with special needs, who now have gone on themselves to be contributing good things to this world. She just welcomed her second grandbaby this past month, and their hearts are overflowing with love and joy. Do you see the ripple effect? I see the thinly veiled excuses of HB 2024 referring to the financial burden of the legal system. Who among you is counting the cost of the ripple effects of the shattered lives of the abortion industry and the emotional toll which leads to mental illness, addictions, drug-related crimes, and incarcerations? I see a lot of what was being thinly veiled in fine print about the legal and financial burdens on the system. And I ask you to consider the financial burden to society in the long run. And I have to refer to my notes. I'm sorry. Let's also consider the further burden of loss of life through despair and suicide. Is there any among you that has not been touched by suicide? Who foots the bill for those medical expenses and burial costs of a homeless person separated from family due to mental illness and addictions? Do you see the ripple effect? I'm opposed to HB 88 as well because it's called reproductive rights being a personal decision, thinly veiled as abortion care. Naive, misinformed young girls are purposely being used by a male-dominated abortion industry that is only in it for profit. I'm a victim of. And I have to live with myself for the rest of my life. And on Judgment Day, I will stand before the Lord and that baby and account for what I have done. There is nothing caring about abortion services. It's a lie. The veil of deception and propaganda needs to be exposed and criminalized, not protected. The irony of HB 2024, which removes the penalty for services rendered which may cause harm, versus HB 88, which imposes a penalty for services withheld, perceived to cause harm. Do you see the absurdity in this? These House bills open with the heading, "In the year of our Lord, 2023. I leave you with this question. Who is your Lord? Lord, have mercy on us all. Jesus, I trust in you. Thank you.
Thank you very much for your testimony, Ms. Gibbons. Are there any questions from the committee? Seeing none, thank you very much for your time. The chair will call Catherine Schlottman. Yes, please begin.
Good afternoon. My name is Kathy Schlottman, and I oppose HB 224. First of all, I would like to thank each and every one of you for all you do for the citizens of New Hampshire. Second, I would like to share a few scriptures from the Bible in regards to what does God's word, the Bible, say about life and life in the womb. You were all sworn into office with your hands placed on the Bible. However, it's what is in the inside that's most important. Here are the scriptures I'm going to read to you. The first one is from Genesis 1:27. For God created mankind in his own image. In the image of God, he created them. Male and female, he created them. Second one is from Psalm 139:13-16. And that says, for you created my inmost being. You knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that full well. My frame was not hidden from you when I was made in the secret place, when I was woven together in the depths of the earth. Your eyes saw my unformed body. All the days ordained for me were written in your book before one of them came to be. The next one is from Jeremiah 1:4-5. And that says, the word of the Lord came to me saying, before I formed you in the womb, I knew you. Before you were born, I set you apart. I appointed you as a prophet to the nations. Next is from Luke 1:39-45. And that says, at that time, Mary got ready and hurried to a town in the hill country of Judea, where she entered Zechariah's home and greeted Elizabeth. When Elizabeth heard Mary's greeting, the baby leaped in her womb, and Elizabeth was filled with the Holy Spirit. In a loud voice, she explained, blessed are you among women, and blessed is the child you will bear. But why am I so favored that the mother of my Lord should come to me? As soon as the sound of your greeting reached my ears, the baby in my womb leaped for joy. Blessed is she who has believed that the Lord would fulfill his promise to her. I pray that you hear each of these scriptures and receive them. And lastly, I will end with this verse. It's from Deuteronomy 30:19. And that says, this day I call the heavens and the earth as witness against you that I have set before you life and death, blessings and curses. Now choose life so that you and your children may live. I pray today that you choose life. Thank you very much.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much. The chair will call Tom Sherman. He's out. I saw him outside. I saw him peek his head in the door. Huh? Yeah, I saw him peek his head, and I'm like, oh, he's here. Yes, okay. Just so you know, Tom Sherman's he's our former colleague. He come on forward, Senator Sherman. It's a pleasure to see you.
Great to see you too, Madam Chair. Hi, team. This is on, right?
Yep.
So for the record, my name is Tom Sherman. I'm a physician from the Seacoast, former state rep and state senator. And I just wanted to share some thoughts on SB 224. So thank you so much for allowing me to speak. Late one night as an intern, in my first year as a doctor, I was called to the bedside of an elderly man I'd been joking with just a few days earlier. Admitted with terminal lung cancer, he was suddenly having a massive arterial bleed from his lungs. There was nothing we could do, so I just held him in my arms. I told him I'd stay with him until the end, which came in just a matter of a few minutes. When you've been right there, whether you're a patient or a provider, you understand how incredibly personal and private medical care is. And until you've been right there, whether you are a patient or a provider, you have no idea how quickly things can change. A joyous occasion like the hope and the future that a third trimester pregnancy brings can become a medical crisis threatening both the mother and her fetus. In that instant, clinical decisions must be made between the mother and her medical team, and there is no time for a consultation with a lawyer to make sure that patient is sick enough to meet the Fetal Protection Act criteria and avoid felony prosecution. This is not a partisan issue. This is about our shared values of allowing medical professionals to do their job to protect the life of both the pregnant woman and her fetus without government threat or intervention that actually increases the risk for those patients. For these reasons, I urge you to support SB 224. Thank you very much. Happy to take any questions.
Thank you very much, Senator. It's a pleasure to see you again.
Great to see you.
If you put Senator, I would have noticed that it said Senator Thompson. We would have had you up here sooner. Are there any
No problem.
questions from our committee? Seeing none.
Thank you.
Thank you. Okay, the chair will call Victoria Gullah.
Thank you. I just got called to pick up my daughter early, who has an earache. Never ends.
I'm sorry, please.
Okay. Thank you. I grew up here in New Hampshire, and I lived in New York for many years. I have two children. I have a 10-year-old and a 5-year-old. I'm an older mother. I was 39 and when I had my son, and 44 when I had my daughter. And I want to tell you all, remind you that while we go to hospitals for care and life, they have this incredible culture of death. As an older mom, I was pressured to have all kinds of anatomy scans, all kinds of amniocentesis, which I declined because of the risk of small risk, but still a risk. And when you're 39 and 44, when you're pregnant and you've had a couple miscarriages in between, you know, you don't want to risk the 1% chance of having a miscarriage from amniocentesis, but they push it, push it, push it. Why do they push it? Culture of death. They want to abort anyone with any sort of fetal abnormality. Also, when I came up here, my son was born in New York. My daughter was born here in the Dartmouth system. In their intro papers you get when you have your first visit with them, they say that they can reduce trisomy 18 and Down syndrome because of their advanced anatomy scans through ultrasound. The only way that it happens is through abortion. So when these medical providers come here and testify in favor of this bill to take away the penalties of late-term abortion, they are saying that they're going to violate that law. That's the only reason they're here. They want to promote the culture of death. They want to kill babies. They don't want anyone with an abnormality to come because they don't want it to look bad, I guess, against their practice that they deliver babies with, you know, that aren't 100% perfect in their eyes. So that's the culture that they promote. So when you listen to them, you have to keep that in mind, that that is what they're doing. That's their goal. that's that's pushed on parents all the time. And I experienced it when I had one of my miscarriages. I had missed miscarriages. Missed miscarriage is when the heart, it was very early, the heartbeat stops and you don't have the miscarriage at home. And I wound up having to have the chemical abortion because the miscarriage wasn't happening naturally. And the ultrasound tech and then the doctor comes in, she was very young, and she says to me, she went from calling it the baby to then the fetus. Because now you can see that, you know, the heartbeat was slower at the previous week. So now it's a fetus. It went from a baby to a fetus. Then she literally said, called my baby products of conception. And what we're going to do about the products of conception, meaning like, are you going to come in for a D&C? Are you going to do the, you know, the pills to induce the miscarriage at home? You know, that's their language. She's flipped it right there. The young doctor right out of medical school called my baby products of conception. This is their culture. So they are going to break this law, and they are definitely going to break this law. They're coming here, they're testifying and saying that they are lawbreakers. That's what they're doing here today. And you need to realize that. And the only way you stop people from breaking the law is to have penalties. What did they do in New York City and San Francisco when they took away the penalties for the smaller crimes? They're closing drugstores in these neighborhoods because people are swarming and stealing stuff because there's no penalty. They can just go in and steal with no penalty. When I was very young, like 22, first moved to Boston, I thought, oh, I'm going to get a credit card, build up my credit. So what happened? I get robbed from my mailbox from my neighbor, and she went and stole $499 out of the limited because the limit was $500. And
I have to appreciate the
you know
testimony.
why?
It is a
But they
3-minute
didn't
time limit.
prosecute her, because if you don't have penalties, they don't prosecute and they do it again.
Thank you for testimony. We do have to keep a 3-minute time limit that was set at the beginning of the hearing.
All right, thank you.
Colleen McCormick. And Ms. McCormick, just a reminder, there's a 3-minute time limit for all testimony.
Thank you. Most of this is not my testimony. Honorable Senators, good afternoon. My name is Colleen McCormick. My clinical specialty is anesthesia. My second graduate degree is in medical ethics, and it is as an ethicist that I speak today. When I was a young parent, I read a book that influenced me greatly called Teaching Your Children to Tell Themselves the Truth. I bring this up because living in our culture for the past half-century, we have been exposed to a great number of falsehoods surrounding the practice of abortion. Many of these falsehoods are accepted without scrutiny because we are exposed to constantly repeated messages, always spoken with great authority. A review of the actual scientific data would refute these messages. All the foundational principles for ethics I had probably learned by 10th grade. That was the year Mr. Meisenheimer explained that the ethics of human ecology is a 0-1 calculation. Either every human being has a single unit of value, or each human being has no unit of value. Because once you decide you can explain away one person's value, you can rationalize away anyone's value. Have you ever considered the course of human history in this matter? It seems with only brief respites, the ugly truth is always there. Some category of humanity is always made the scapegoat, the whipping boy, or the chattel. It may be people of color, women, Irish Catholics, Orientals, Jewish people, Muslim people, the list goes on. Slavery and indentured servitude for the purposes of financial gain are imposed at the dehumanization of the designated underclass du jour. Child labor practices are one such historical example of turning the human person into a marketable commodity. What do you suppose incites such attitudes and behavior in a society, and why do we never learn the fundamental lesson? Rather, we pat ourselves on the back that we have obliterated one practice of injustice only to trade it in for another. In each circumstance, a false narrative must be created to support the practice of man's inhumanity to man. For the past half century, the falsehoods have been many, including an assertion in the 70s that the embryo is more like a fish or a cat than a human, as if millennia of evolution take place in the course of 40 weeks gestation. Then came the various disclaimers and euphemisms. It's just a clump of cells or a mass of tissue or products of conception. Finally, we are told that this may be a human being, but it is not yet a person. Another word game to provide a distinction without a difference. Since the practice of ultrasonography has become commonplace, anyone can refute these misrepresentations. The latest falsehood is the contention that the fetal heartbeat is not really a heartbeat, but random electrical activity. As one who performs ultrasonography, I can assure you that at 6 weeks gestation, what you find on examination is a regular rate and rhythm of about 120 to 140 beats per minute, consistent with a heartbeat, not random electrical activity. The study of embryology is actually centuries old. Miscarried embryos and fetuses at various stages of gestation have been studied since long before Roe v. Wade. The first organ system to develop is the neurological system, and pain can be mediated at 7 weeks gestation. I have 121 research studies to show that at 7 weeks gestation, pain is experienced. I think my time was up, huh?
Yes, it is.
Can I just make one last statement?
Yes, please.
Every culture on earth is either a civilized culture or it's a barbaric culture. The difference is, in a barbaric culture, the powerful can prey upon the weak and the vulnerable, and it's considered normal. In a civilized culture, the powerful protect the vulnerable from those who would act against them. Thank you.
Thank you. Are you Ms. Yanayan?
I'm Colleen McCormick.
Colleen McCormick. Okay, I just want to make sure.
I didn't call you.
Oh. Not a problem. Thank you very much for your testimony. We appreciate it. The chair will call Kathleen Yanian.
Good afternoon. My name is Kathleen Yanian. I'm a resident of Chester, New Hampshire, and I've redacted my statement here quite a bit because of what's been given today. Thank you for this opportunity. I would like to thank Sam and his mom. I think that witness is above all the greatest that we've seen today, the love and the love of life and the care, and for them coming today to help others is amazing. I think it's very clear to most people that a vote for this bill is a vote for abortion up to birth. The attempts at verbal masking, products of conception, clump of cells, choice, that speaks for itself in the dishonesty of what happens in the medical field. Medical staff who have testified have only heard opinions, not real statistics, demographics, anything of the sort, just their statistics, just their opinions. We've been told to follow the science regarding the pandemic. I ask you to recognize the humanity of the preterm child and follow the science. If you can compromise on life, you can compromise on anything. To Democrats, Republicans, Independents, I ask you to seek the truth, oppose this evil, and vote in opposition of this bill. Thank you.
Thank you very much for your testimony, Ms. Yanni. Are there any questions from the committee? Seeing none, thank you very much. The chair will call Allison Bodell.
She's here.
Thank you.
Good
Thank you very.
afternoon, Ms.
Thank you.
Waddell.
Thank you very much for having me. Everybody that has spoke very well and has said most of the things that I'm going to say. But I'm just going to reiterate one more thing. So correct me if I'm wrong. If one person uses an instrument to stop the beating heart of another one, what do we call that? Do we know what we call that? What would anybody say that we'd call that if you take an instrument and stop a beating heart? What is that called? It's called murder. It's called murder. So now how I ask you, how is this any different than an abortion, especially in the late term when these babies are babies? And if any of you have ever had a pregnancy at 24 weeks, 6 months, those babies are just rolling around in your tummy and you know that it's life and it's your child. So I want to thank you for your time and for what everybody else said too. It's been great. Thank you.
Thank you very much for your testimony, Ms. Waddell. Are there any questions from the committee? Seeing none, thank you.
Thank you.
The chair will call Dick, is it LaFleur? LaFleur, okay. Okay, thank you.
Thank you. Never could pronounce my name.
Let me know when you're ready.
I'm ready.
All right,
Are you ready?
I'm ready.
All right. Well, first of all, my name is Dick LaPlume, and I'm pro-life. And I'm here in opposition to House Bill 224. First of all, I just want to let you know I whipped these notes out this afternoon, so if I sound a little incoherent, so sorry. But I'll try to be as coherent as possible. There were over 1 million abortions in our country each year. Can anyone here in attendance tell me how these abortions have anything to do with women's health? Or is being pregnant these days unhealthy? Or is it maybe just inconvenient to one's lifestyle, even when abortions are still allowed after 24 weeks? Is there a need to strengthen your legislation that was reluctantly signed into law by the governor? If HB 224 passes, there'll be no limits or penalties on abortions after 24 weeks. We in the pro-life movement were given half a loaf. Now that HB 224 is being considered, the whole loaf will be taken. If HB 224 is passed, the bottom line is that organizations such as PP profit much by every abortion. And they donate much to political entities that result in favorable legislation like HB 224 that help Planned Parenthood and other such organizations to blossom financially. No, I'm not a radical Christian conservative as opponents might have me look. I will always pray for my opponents to have a change of heart, to love, help, and support parents in need. As for me, I will always speak for the fetuses yet to be born. Hopefully a voice for the voiceless, a voice for reason and love for the unborn babies. I have one final question for us to ponder, and excuse me. If you believe in God, that is, if you do, what side do you think he's on? Thank you, and God bless you and all the beautiful unborn babies yet to be born. I can go on about this, on and on, but enough said. Anyway, have a great Easter, everybody.
Thank you very much for your testimony, Mr. LaPlume. Do you want to answer any questions if somebody has some? No? I guess not. Okay, thank you very much for your testimony. Next, we're going to go to Corinne Pinto. Want to remind everyone about the 3 minutes? Let me know when you're ready, Ms. Pinto.
Yes, good afternoon. I'd like to thank you for allowing me to speak today. I'd like to thank this committee. I actually sent you all an email this morning, so I'm just going to quickly summarize it. I wasn't expecting to be here. My name is Corinne Pinto. I'm a single mother of 3 sons, ages 10, 16, and 21. I'd like to share a Bible verse from James 4:14, which says, "Yet you do not know what your life will be like tomorrow. You are just a vapor that appears for a little while and then vanishes away." I'd like to ask everyone here today, have you thought about your life? How did you get here? Who created you? What happens to your soul when you leave this earth? These are vitally important questions to ponder, especially in light of why we're here today. The fact is, we do have a creator. He is one God, the creator of all things, and in him all things hold together. He has commanded us to not murder innocent life. At the moment of fertilization, a separate life is created with separate DNA from mother and father. To murder innocent life at any stage is to violate God's command. And as 2 Corinthians 5:10 states, "For we must all appear before the judgment seat of Christ, so that each one may receive what is due for what he has done in the body, whether good or evil." To vote against this atrocity is to stand with God and against evil, but to vote for it is to have blood on your hands. If you may say that you do not believe in God, if so, I tell you that you're a liar. Romans 1:18 through 20 clearly says that no one created by God can look at the human body or anything in nature and say that there's no creator. Rather, you suppress the truth in unrighteousness and are without excuse. God is sovereign, and there is no mistake that you were chosen for this very time on this very day. It's ironic that you sit on a committee rooted in defending God's law, and today God has set before you the task to publicly denounce or perpetrate the murder of innocent babies up to birth. As I close, I'd like to reiterate the point I opened with, which is the question, where will your soul spend eternity? Our lives are but a vapor, and we're not promised a minute from now. But in this very moment, we have breath. We can repent of our sins, put our faith in the only Savior, the Lord Jesus Christ, and I pray that you do. I thank you for your time today, and please remember that God's law is supreme and eternal, and no one is exempt from it. Thank you. I'll take any questions you have.
Thank you, Ms. Pinto. Are there any questions from the committee? Seeing none. We've had a lot of folks testify already. What I'd like to do is to take a 5-minute break so our committee secretary can get up and stretch his legs for a few minutes. I hope you don't mind. So the committee is in recess for 5 minutes, and we'll be back at 3:15. Yes. No, we have 5 minutes.
or heard of a termination of a normal pregnancy at 24 weeks. Now, there are three circumstances where we do need to abort a pregnancy. I like to use the term prematurely deliver a baby. It's not an abortion. First scenario is a dead baby. I think we all agree that a woman carrying a dead baby should have the option to induce labor and deliver that baby. There actually is a complication of pregnancy associated with dead babies, a coagulation disorder that can threaten the life of that mom if it's not terminated. Second scenario, a fatal fetal diagnosis discovered by ultrasound late in the pregnancy. Most moms want to be induced prematurely delivered with these babies, so they have a live baby when they deliver, and they have those few hours or days to spend with their live baby before it passes. Third situation, much more complicated. It's when there's a complication of the pregnancy threatening the mom or the baby's life. Bleeding, infection, and severe hypertension are common. I've delivered women prematurely with severe preeclampsia, bleeding with an abruption of a placenta, overwhelming infection, and these babies have died. Did I commit a crime? I don't think so. Finally, I want to make a point here. This law is very threatening to any obstetrician delivering babies. We have specialists, maternal fetal medicine specialists, who usually make the decision in delivering a premature baby. There are 2.5 of these specialists at Dartmouth and 1 in Manchester, after 2 have retired. We are not going to be able to recruit these specialists who have been responsible for the fact that we own the second lowest perinatal mortality rate in the country. We are not going to be able to recruit these people with a law threatening them, criminalizing them. So I want you to understand, there are no elective abortions after 24 weeks of a normal pregnancy. And when we get into a difficult situation and have to make a decision whether we deliver that mom or not, the threat of criminalization should not weigh into that decision at all. I ask you to vote ought to pass in support of HB 224. I would like to take any questions.
Thank you very much.
Thank you. Thank you for giving me cuts.
Hi, good afternoon. Thank you very much for hearing me and for your service to our state. And my testimony is pretty simple. This is a picture of my great nephew. This is Julian Kicklighter. Julian was a very high-risk pregnancy, both to him and to his mom. And she did have preeclampsia as well as other complications. And she just, we prayed, and they were so rejoicing when they made 24 weeks. And this little guy was born at 26 weeks because it was a risk to both he and to her. And this is just showing that a child at this age is a child in his own right. And there are heartbreaking decisions. I have a very close friend of the family who just had to make a heartbreaking decision to end a pregnancy that was dearly, dearly wanted. And that is a personal decision. But when you're looking at making a decision to end a pregnancy for something that is not that medical situation, you're looking at making a decision for an unborn child and discriminating based on whether or not his parents want him. You know, a law without any enforcement mechanism becomes a sham. And it looks like we have protections for life that actually are unenforceable. And it then is almost worse than no law at all. And prior to this law, in New Hampshire, we had one of the worst protections for the unborn in the country. And we still do not keep any records that I'm aware of to know how many women develop serious complications. In light of that, how can we say abortions are health care for women when we don't know the safety record? A late-term abortion is horrific for the child and also more dangerous for the mother. So it's something that I think at 24 weeks, unless there are very serious medical complications, I think it should not be something that would be allowed, and I don't think we should have a law in the books with no enforcement mechanism. So thank you very much for hearing me.
Thank you very much for your testimony. Questions, Ms. DeGrazia? Seeing none, thank you very much.
Thank you for your time.
Chair. Call Gary Gorson. Ready?
Okay. I'm ready. Hello, my name is Gary Torreson. I'm a former state representative for the town of Moultonborough. It's great to be here before this committee, honorable members of the Senate Judiciary Committee. I'm here speaking on behalf in opposition of House Bill 224. I'm doing that on behalf of my family, my children, my grandchildren, and future grandchildren, and all the unborn future generations that will come in this state. I appreciate what the doctor had said earlier, but I trust that doctors will make the right decision and fight to keep the lives and protect the lives of both the women and the babies at late stages of pregnancy. But my testimony is that penalties in every one of our laws is equivalent to a metaphor of a strong protective lion with sharp teeth and claws. They are a very real deterrent. Only a fool would approach a lion and stick their head in its mouth. So, as House Bill 224, removing penalties to the Fetal Protection Act, or any law for that matter, it would be the same as declawing a lion and removing its teeth. It is then rendered harmless and defenseless. HB 224 and its sponsors and Planned Parenthood's attempt to undermine a life-saving law and make it nothing more than a weak, empty words in our law books. The New Hampshire Fetal Protection Act is working. It's a new law. Let it work. It is saving lives by defending the defenseless, unborn, viable babies, like the protection a lion does with its teeth and claws. So I urge the committee to stand firm and do not waver of the empty arguments of those who do not care about innocent beating hearts of viable unborn children. Shame on anyone who does not feel they need protection under our laws. I urge you to vote ITL on House Bill 224 and not declaw our laws. Thank you for your time.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The chair will call. You know, you're ready, Mr. Boston.
I'm ready. Thank you, Madam Chair. My name is Robert Lacoste. I'm a retired nurse anesthetist. I'm a retired lieutenant colonel in the United States Army. I was in healthcare for over 36 years. I made, as a practicing healthcare provider, made critical decisions in tough situations. And I think this HB 224 is a mistake. When I practiced, I was under restrictions, what I could do, what I couldn't do. I was subject to criticisms for investigations into my actions if there was a problem, even if there wasn't a problem. So I think that many of the professionals, quote unquote, who've testified here before and worried about the legal implications of their actions are short-sighted and self-serving. I've cared for Well, back up. When early in my career, I had a colleague, a registered nurse, who knew she was carrying a stillborn child, and she carried that baby to term. That was her decision. In my practice, I've cared for a baby that was 24 weeks old, alive. She needed some help breathing, but she was alive. I've cared for a 99-year-old. Are we going to be picking winners and losers with this, with abortion? Are we going to be subjugating the elderly when they're too old to take care of themselves? Just like the unborn are too young to take care of themselves? In the 24th week and beyond, if a pregnant lady is having problems, one of the possible solutions is a C-section, is a chemical abortion after 24 weeks. Okay, the doctor that just testified, does he know that they aren't providing 24 abortions after 24 weeks with chemical abortions? Let's see what else. On a personal note, I have a great nephew who was born last July, and he has what's called hypoxic ischemic encephalopathy. He's brain damaged, and probably mistakes by both the physician, obstetrician, and the nursing care and the hospital policies. That's a whole nother story. But that child, brain damaged, but he's loved and he's cared for. Finally, I'll close with this. It's unacceptable to refer to health care and abortion in the same sentence. I worked in healthcare for so long, and I never saw an abortion that took care of a baby. Anyway, thank you. Any questions for me?
Thank you very much for your
Thank you all.
Thank you. Thank you, sir.
You're welcome.
Okay. Okay, next we're gonna call Joshua Pass. Let us know when you're ready, Mr. Pass, and I'll get started on the timer.
I am ready. Well, good afternoon, and I guess we all know why we're here, and I think one of those reasons may be for the air conditioning. But I suppose that this bill would tie back to whether we believe abortion in itself should be allowed or not, and I realize that this is a very, very sensitive topic. Let me tell you, I do know several people. I have some close friends and a cousin or two who were born out of wedlock, and their parents decided not to abort them, and I'm very glad they didn't, because now they're very good friends of mine, and I care a good deal for them. And if their parents had decided to abort them, I would be short a few close friends. And my point being that if abortion is allowed to continue, then there are children today who would be losing future friends. And someday I hope to serve in uniform, so, well, thank you to service to the Colonel. I have a vision to see this country become a beacon in this world to those who are losing hope, and we can see that everywhere. I love this country, and I love my countrymen, and that means everybody in this room. I don't care what people's background is, what their political party is, and nor do I care where anybody stands regarding this bill. I'm dedicated to serving and protecting everybody within the borders of the U.S. But my mother is also an abortion survivor, and I would not be saying these things if my grandmother had succeeded. My grandmother swallowed whatever she could, short of swallowing glass, to induce an abortion. But my mother's oldest sister stepped in and asked her mother to let the child live, and she would take care of it. I'm very glad she did. And now my mother is the one taking care of my grandmother. And my grandmother told my mom what she tried to do and said that she was very glad that she had not aborted my mother. So, and even if I weren't who I am today, even if I had the most humblest of beginnings, even if I didn't want to serve, I could still be a friend to at least one person. So I think at this point you can see where I'm standing on this bill, and I ask that you would not vote for this bill Do not make abortion any easier, and let the unborn live and give them the chance to prove their quality. Thank you.
Thank you very much for your testimony, Mr. Pass. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The chair will call Richard Johnson. Richard Johnson. You choose. Just let me know when you're ready to start, sir, and we'll start the 3 minutes.
Ready to go.
Okay.
Madam Chair, members of the committee, my name is Richard Johnson. I'm a physician. I live in Dunbarton, New Hampshire. Thank you for taking my testimony, which is against House Bill 224. I just want to make 3 key points. One, the words that are used to advocate for abortion distort reality and deceive the public. For instance, reproductive rights, no one's denying the right to reproduce. China tried it. Certainly the aborted child is denied its reproductive rights. Abortion is health care. Any physician taking care of a pregnant woman knows that they take on the care of 2 individuals. An abortion denies that care to one of them. My body, my rights, the developing baby in the womb is a biologically separate entity from the mother. It's not a pathological process. My point number 2, legislation should be about protecting the rights and safety of those who are vulnerable. This is a 24-week-old child that we're talking about. Old enough to survive outside the womb, she or he needs protection. Indeed, that is why we have child protection laws. One's level of maturity should not determine one's right to protection. Final point, number 3. I'm a physician, and like most physicians, indeed like most people, I do not like to be told what I can and cannot do. Laws, however, are in place to protect those who are vulnerable to abuse by those in power. One can be vulnerable by virtue of their race, their religion, their age, their sex, or their inability to comprehend consequences or implications of treatment. But physicians are not above the law. In our own RSA 329, I quote, "It is necessary to provide laws and rules to regulate the granting and subsequent use of the privilege to practice medicine," end quote. It's important to remember that the current law does not restrict abortion from conception through the 2nd trimester. It does not prevent the delivery of a naturally deceased fetus. It allows for the delivery or abortion of a 24-week fetus which has fetal abnormalities incompatible with life. And it allows for abortion if the life or health of the mother is endangered. The current law only criminalizes one who takes the life of a healthy 24-week-old baby living in a healthy mother. Thank you, and I'll be glad to answer any questions.
Thank you very much for your testimony, Doctor. Are there any questions from the committee? Seeing none, thank you very much for your time this
Thank you.
afternoon.
Can
The
I
chair,
leave-
I'm sorry?
Leave written testimony for anybody?
Yes, please hand it to Matthew, our committee aide. Oh, I know. The chair will call William Courier. Thank you. Let me know when you're ready, Mr. Courier, and I can get the timer started.
I'm ready.
All right.
Okay. Good afternoon, and thank you for giving me a chance to speak. I live in Salem. I'm a member of the public, and I represent myself. I'm opposed to HB 224. In New Hampshire, it's a Class B felony for any healthcare provider to perform or induce an abortion after 24 weeks of pregnancy, i.e. during the 3rd trimester, with a few exceptions. The majority of Americans believe that abortion should be legal after the 1st trimester. Many states have protections from abortion at or less than 24 weeks of life. HB 224 would repeal all civil and criminal penalties and even professional discipline from a medical board against healthcare providers for violating the Fetal Life Protection Act, which is the only legal protection in New Hampshire for unborn children. Since an unborn baby during the third trimester of pregnancy is viable outside the mother's womb, he or she can be delivered prematurely and survive. So there's no need for an abortion in case of that. I ask you to please vote this bill inexpedient to legislate. Thank you.
Thank you, Mr. Curry. Are there any questions from the committee? Seeing none, thank you very much.
Yes.
Okay, the chair will call Michael Lewis.
Chairwoman, members of the committee, I apologize in advance. I wore a suit. The other lobbyists are asking me where my orange name tag is. I'm not a lobbyist. I'm a citizen, a retired aerospace and defense executive, not representing any group in particular. So thank you for your time here and your attention on what is a hugely demanding issue, highly emotionally charged. I oppose removing the penalties, but not really for reasons you may have heard already. I recognize the law and its mechanism is, I would call, a compliance enforcement mechanism, the penalties. And there's no perfect system. There's some problems with that. And what I'd say you need to do, my recommendation would be to come up with a better compliance enforcement mechanism before you remove the penalties. What's unique about this is the backup, relying on a board of medicine, isn't going to work. If you look at the actions posted on the Board of Medicine website, the thing that raises an action to the Board of Medicine is a complaint by a patient of mistreatment by the doctor or an adverse information report from out of state. But in the case where the patient wants to break the law and the doctor wants to break the law, no one's going to raise the complaint. So it's not going to work. You have a mechanism, but it's structured for a system where the patient's interest and the state's interest align on justice. In this case, the door is wide open for that not to happen, right? So that's my position on keeping the penalties until you come up with something that's better. I don't know what that better thing is, but I think I would look at what are the other states doing to have time limits, and what does the medical community and the Board of Medicine suggest would promote compliance. Because the goal is compliance with the law. Now, two more things. In the process of coming up to speed on this, I did go back to the Fetal Life Protection Act. And highlighted in orange here, I noticed a statement. We adopt the opinion that the fetus from the time of conception becomes a separate organism and remains so throughout its life. This is our position in New Hampshire, apparently since 1958. Right? So, with that in mind, I offer you kind of a framework for considering whether we should be doing this at all. So, the bulwark, not removing penalties, should we be doing this at all, if that's what we stand for in New Hampshire? So, I'll leave this with you, but we really live in one of two realities. Either life begins at conception or sometime later. And across those realities, we can apply a value set to support abortion or support life. And so you end up with these four intersections. So at the intersection where life begins at conception or supporting abortion, the people have the same data I do. That means we're killing about 1 million children a year. If you think life begins sometime later, it's 70,000 or 10,000. The only way to minimize that is to avoid doing it at all, right? So it's really a risk consideration. Even if you don't believe we are, there's a risk that we are killing those children, and that's an unreasonable risk. Thank you for your time.
Thank you very much for your testimony, Mr. Lewis. Are there any questions from the committee? Seeing none, thank you again very much. Was that Ms. Boucher? Yeah, I'm sorry. I'm gonna bring her forward. She's got 2 little kids and, yeah, and she might want to, it's late in the afternoon. So please, anybody who's been a parent knows that it's a been there, done that kind of thing. And they're tired. Come forward, please, Ms. Boucher. Where's your son? Where'd he go?
Very nice people are watching.
Okay. We always like to see children in here. It's great. Please identify yourself for the record.
Sure. I'm Dr. Bergeron. I'm a wife and a mom, and I'm a family physician who does OB. I'm a graduate of the Dartmouth Brown program, and did my residency at Maine Med. And I've never spoken anything like this before. I will try not to repeat anything, but I wasn't listening to the whole thing, so I apologize in advance. The main reason I felt called to come speak today is just I feel like there's some misinformation. A couple of the speakers I heard, and just want to clarify a few things. One is that in the case of if I have someone coming in who has a life-threatening, who's pregnant and has a life-threatening emergency, whether it be severe preeclampsia or bleeding, as some of the other physicians mentioned, always the mother's health is taken. There's no consultation with a lawyer or any need for that. It is always standard medical practice for that woman to receive care. So care would not be withheld before or irregardless of what the standing on abortion laws were. So I just want to make it really clear that those don't apply to this situation. Then the second thing is just that it seems unnecessary. We already in New Hampshire have really lenient, we can perform abortions up to 24 weeks. And after that, in the case of the mother's life being in jeopardy or a fetal anomaly. So this does not seem to be a necessary addition or to our laws. And it, or not, just whatever. Also in terms of decriminalization, so I think this could have decriminalization could equal legalization. And how we see in the society, if something is legalized, we consider it okay. We consider it to be socially acceptable, morally acceptable. So we're not really talking, there aren't physicians being jailed right now or losing their license for following medical guidelines, which would not include terminations or abortions after the age of viability. And I just wanted to tell a little bit of our personal story. So I have a son with Down syndrome, and this is Henry. He's coming to us for adoption with Down syndrome. And often babies who have anomalies like Down syndrome are terminated. And we often can see medicine as not being biased, but in my experience, when women often receive a diagnosis with an anomaly, it's been given as a pathology, as a scary diagnosis, as something to be afraid of. And the physician's bias often impacts what decision a woman makes. So it's not just self-determination. Often that self-determination is influenced by our culture and by our medical field. And I've experienced myself in my own prenatal diagnosis, and almost everyone I know who's a child with a disability has experienced that same pressure. His mother was very strongly pressured to terminate his pregnancy because she had a drug problem. She didn't have custody of her children, and she was not encouraged to continue her pregnancy. She made a super brave, amazing decision to go for adoption, and I'm really grateful to her. She's an amazing person, but there's a lot of bias and I'll just stop there as my hair gets removed.
Believe me, I completely understand.
Does anyone have any questions?
Does anyone have any questions for the doctor, Dr. Bergeron?
All right.
Seeing none, thank you very much. Okay. And your children are delightful.
Thanks.
I know that.
They can pull your hair.
Yeah. He wanted to go. Cam, could you find Stephen Mashad and Denise Mashad? These are more folks with little children. So. I had to come forward because we thought you had the kid with you. He handed him off.
They're having fun. Displaying much
let me know when you're ready. You have 3 minutes.
Okay.
Oh, here we come.
Did you hear me, John? The mother shouldn't be your only concern in these delivery rooms. You have 2 patients, not just one. Good afternoon. Thank you for an opportunity to speak to you. My name is Stephen Misha. I'm speaking in opposition to HB 224. I am currently working as a family physician in my hometown of Goffstown, New Hampshire, a New Hampshire native. Before going to medical school, I worked as a public school teacher at Goffstown High School, drove an ambulance in Manchester, worked at the VA Hospital Center before finally attending medical school in Philadelphia on an Air Force scholarship. After my family practice residency in Portland, Maine, and 5 years of active duty in Georgia and Italy, I was finally able to pursue my lifelong ambition of becoming the family doctor in my hometown of Goffstown. As a family physician, I have had the privilege of taking care of patients from birth to end of life, as well as the opportunity to care for 3 generations of a few families. Although I have not delivered babies since early in my career, I did learn from several wise mentors in family practice the concept of continuity of care and the importance of taking care of mother and baby at all stages of pregnancy and often after delivery. One of the unique benefits of family practice was being able to care for a mother during pregnancy and then continuing that care in the office for both mom and children. This brings me back to my opening quote and HB 224. I hold the firm belief that the highest standard of care we as a medical community should strive for is to make sure that the doctor-patient relationship extends to both mother and the unborn, especially at and beyond 24 weeks. This guarantee will only be possible if the Fetal Life Protection Act is left unchanged with criminal and civil penalties left in the law. Without these penalties, killing a 6-month-old unborn child would be possible without any consequences. My introductory quote was taken from a book by now pro-life obstetrician Dr. John Bruchalski. He was being reminded by the hospital neonatologist regarding the true standard of care. After hearing those words, he writes, "I wonder if I have been practicing a double standard. Why was I doing everything I could in one room to save the life of an unborn baby, but so quick and willing to get rid of another one in the room next door? Was my standard for life really based on whether the mother wanted the child inside her womb?" This interaction took place in 1989 in Virginia. At the time, abortion was illegal in Virginia at 24 weeks and older because the fetus would have a 50% chance of survival outside the womb. Now, 30 years later, with much greater survival rate, I firmly believe that we need to do everything possible to assure that unborn babies at 24 weeks and beyond are allowed the protection that the current Fetal Life Protection Act assures without changes. And I'd also like to mention, I've heard, there's probably nothing new about taking care of 2 patients, but the assertion that OB docs won't come to New Hampshire and hospitals closing, I would certainly not accept that at face value. Having interviewed physicians and being interviewed myself, I would urge you to delve more into that issue that was mentioned by a number of providers. Thank you for your time.
Thank you very much, Doctor. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The chair will call Denise Michaud. Let me know when you're ready, ma'am.
Yes. Good afternoon. Thank you for giving me this opportunity to speak. My name is Denise Michaud, and I'm a resident of Dunbarton. I'm speaking in opposition to HB 224. I'm a pediatric registered nurse with just under 40 years of experience, working mostly in a hospital setting, both Children's Hospital of Philadelphia and at different times 3 smaller community hospitals here in New Hampshire. As an inpatient pediatric nurse, I am also cross-trained to work in maternity as well as in the NICU, or neonatal intensive care unit. It is in the NICU that I help care for the youngest and most vulnerable part of our community, those infants who are born prematurely, whether delivered early because of premature labor or because of the mother's health and/or condition was at risk or endangered and was necessary to save the life of the mother and the infant. With advancement in technology and skills, it has become more commonplace to deliver and save premature infants as young as 24 weeks gestation. It is nothing short of amazement to be part of the care and watch as these infants thrive, grow, and develop, eventually being discharged home with their families or caregivers who have long awaited their arrival. I'll never forget an infant I cared for whose mother was greatly urged to have an abortion because the fetus was diagnosed with a serious anomaly, but the mother refused. The mother would later learn that the infant would be born completely healthy with no anomalies. A miracle? Possibly. An incorrect diagnosis? Possibly. But I will never forget that baby whose mother chose life regardless of the prenatal diagnosis. Her physician, who was angered that she would not abort. And in the end, she was overwhelmed with joy, receiving more than she ever expected. I've often wondered how many others have had an abortion to a perfectly developing fetus, but sadly, we'll never find out. Infants of 24 weeks gestation or 6 months of pregnancy are viable human beings and have a greater chance of survival outside of the womb as long as they are provided with and given the expert care necessary to do so. These infants are our children, our grandchildren, nieces, nephews, and neighbors' children who have an inherent right to life, and it is our responsibility to protect that right, be their advocate in doing so. Whether adhering to a doctor's Hippocratic oath, a nurse's Nightingale pledge, fellow citizen, or those with the power to enact bills or laws, we all must partake in protecting our youngest. I ask you to please vote no to HB 224, for if this bill passes, there is no rightful protection that we are all responsible in providing, and there will be no repercussions to the act of selective abortion and ending the lives of viable infants from 24 to 40 weeks gestation. So many that I will not have the privilege and honor to care for, so many that will never have the opportunity to be part of a family or society. Thank you for this time.
Thank you for your testimony, Ms. Michaud. Are there any questions from the committee? Seeing none, thank you very much for your testimony.
Thank you.
The chair will call Neil Hubacker. Neil Hubacker. Good afternoon. Before we get started, I'd like to remind everyone that we've asked, please don't repeat testimony. Please don't read the testimony. If you pass it in, we're not executing the bill today, so we're going to have plenty of an opportunity to read your testimony. And everyone's 3 minutes. So.
Deal.
All right, good. Let me know when you're ready.
Ready to go. Good afternoon, Madam Chair, members of the committee. Thank you so much. My name is Neil Hubacher, and I'm the director of Cornerstone's Church Ambassador Network. We're a loose affiliation of about 350 churches. And normally my work is related to connecting leaders of churches with leaders of all 3 branches of state government to solve issues that face us, like adoption, foster care, addiction crisis, immigration, housing are some of the things we've been tackling, mental health, others. But today I am testifying in opposition to HB 224 because it is such a great concern of many of the churches that I get to serve with. And you are in receipt of my written testimony, and I'll share hard copy as well after this. But just the 2 things that I wanted to pull out from today, because Madam Chair, as you mentioned, you've already had a lot of scripture cited. The main thing I wanted to say was the historical Orthodox Christian church, and the 3 streams that I would include there would be the Eastern Orthodox stream, the Roman Catholic stream, and the Protestant stream. They're all united in a biblical ethic for life that you've already heard at great length today. You know, that human life is worth preserving, that life in the womb is worthy of protection of our civil law, and that to terminate that life is morally wrong. That would be point 1. The second point that I would just want to share is this idea of an either or, that it's either or, either the mother's life or the child's life. I don't think that's an accurate proposition. And I call to wit, the fact that we've got 16 crisis pregnancy centers in our state, that when a woman decides to continue her pregnancy until birth, she receives from them the educational resources, the financial resources, the workforce development resources, and mostly the relational resources, the hope resources that she needs. And so certainly the God that I think most of the churches in the Church Ambassador Network proclaim believe in a God who is abundant and takes really difficult situations and can make them into win-win situations. And so that's the main thing I'd want to pull from what you'll read at some point. So thank you for your time.
Thank you very much for your testimony. Are there any questions? Seeing
Thank
none,
you.
thank you, Mr. Hubecker.
Thank you.
The chair will call Mark Warren.
He has left for the day.
He has left, okay. I'm going to call Rachel Henson. Good afternoon, Ms. Henson.
Hi. I am ready whenever you are.
I'm ready.
So, my name is Rachel Hansen. I'm a student at the University of New Hampshire, and I'm here on behalf of our Students for Life Club there. I stand opposed to House Bill 224. First, I want to thank you all for your time today. I'm sure this has probably been a lot longer than you expected, and it's probably very monotonous at this point. So I'll try to keep it brief so that way I'm not repeating anything that's already been said. So part of what I do at the University of New Hampshire is I major in human development and family services. A lot of that is policy writing. Last semester, we were doing a policy brief, and I was trying to figure out what the current state in New Hampshire is in terms of abortion. And I spent days trying to find numbers. And it turns out it took days because there's no information to be found. I'm sure throughout the consideration of the drafting process of this bill, you've heard many different stakeholders, probably all with slightly different opinions and interests. But have any of them been able to confidently and precisely tell you the number of abortions that annually happen in our state? What about the complication rates that arise from them? What about the number of babies that are born alive? Or why women are seeking abortions in the first place? What resources are they lacking? The number of abortions that happen because of rape or incest? You and I both know that the answer is no, because as it currently stands, the state of New Hampshire does not require any abortion data to be reported or submitted to the state. This has two main implications. There's a lot more, but I'll just stick with those for today. So women considering an abortion have no access to current medical complication rates at specific facilities and more broadly statewide. So any argument that says that we're giving them choices or we're giving them a safe choice, you can't know that because there's no information on that. Secondly, women aren't being given any more tangible resources to help with their unwanted or unintended pregnancy. So regardless of whether a person is pro-life or pro-choice, regardless of whatever your personal beliefs are, as long as abortion remains illegal, your policymaking should be grounded in the most accurate, current, and comprehensive statistical information and health data. Anything other than that seems like pretty irresponsible policymaking. Based upon the information that's provided by the state, it doesn't seem like you have the basis to be able to do that. So not only does this bill fail to protect New Hampshire's constitutional pledge to protect all persons within the bounds of the state, but the bill continues to perpetuate a system that thrives off of the exploitation of women by killing their babies and continuing to deprive them of resources to make informed decisions. Thank you for your time.
Thank you very much for your testimony, Ms. Henson. Are there any questions from the committee?
Thank you.
Seeing none, thank you. The chair will call Jonathan Kimball.
Hi there, I'm ready.
Let me know when you're ready. Okay.
Thank you for having me. I'm Jonathan Kimball. I'm a student at University of New Hampshire. I've lived in New Hampshire my whole life, and honored to be here today. So I am here for just to represent the 60 million innocent lives that have been lost over the last several decades since Roe. There's a couple things that I've noticed as we have been having this extended discussion. The first thing I want to address is the argument that people have been making that in order to protect physicians, we need to allow late-term abortions, which upon any analysis just proves to be patently absurd, because the vowed obligation of the physician is to protect life. And so if we're saying the best way to protect life is to allow the destruction of life, it makes no sense. Additionally, there was an argument made that the best way to that an important aspect is the population of New Hampshire, that we need to pass this in order to bring more people into New Hampshire, which just seems crazy because how can we justify murder by population statistics? It makes no sense. And so I would just plead with you, legislators, representatives, that you have many people to answer to for your decision today. The people who put you here voted for you. You have to answer to them. You have to answer to the children whose lives are at stake. They will get their time in court in the last day, and you will be judged for your decision here. And I hope that you will not be complicit in the loss of their lives. Your children and your grandchildren, you have to answer to them for your decision here. And ultimately, you have to answer to God, the true judge who will bring justice to all things. And I pray that if you are complicit in the murder of innocent lives, that you will repent and receive Jesus Christ and turn away from this wicked, idolatrous child sacrifice that our country has been giving itself to for so many years. Thank you.
Thank you very much for your testimony. Does anybody have any question for Mr. Kimball? Great, seeing none, thank you. The chair will call Jonathan Threlfall. He also had to leave. Okay. The chair will call Kelly Lungholm. Let me know when you're ready, Ms. Lungholm.
Okay. I am ready.
Okay.
Good afternoon, Madam Chair and members of the Senate Judiciary Committee. Thank you for hearing my testimony. I am Kelly Youngholm. I am the executive director at Care Women's Center in Concord, one of the centers that Neil Hubacher just spoke of. We are a faith-based organization. We're a pregnancy resource center. Our main work involves helping women who are in an unexpected pregnancy and do not know what to do. I am speaking in opposition to HB 224, which proposes to eliminate the criminal and civil penalties for those who perform abortions. Removing the criminal and civil penalties of the Fetal Protection Act would make it void, so it doesn't make sense. I just wanted to share two reasons why I feel this way. First is biblically. I know that you've heard a lot of scripture read here, so I won't go into that, but because I am a Christian, I do believe in the Bible. I believe that all life is created and can only be ended by God. Because of this, taking a human life, especially one that can survive out of the womb, I think is morally wrong. Number two, there's a better choice. Every day our center is open. We come in contact with men and women who need intervention. I have many stories of women who come into our center not knowing all of their options. Many of these women do not have the support that they need or they think they need, and then they think that their only choice is abortion. When we describe what we do and how we are there to help and support them, and if they carry their baby, sometimes they choose to do that. There is a narrative out there that centers such as ours only care about the baby, and we do not support the mother and family once the baby is born. That is not true. We continue to support them throughout their pregnancy, after, and we do parenting classes up through any age that they need help with. Because we are 100% donor funded, we can offer classes and material assistance free of charge. We can work with these families to meet their physical, intellectual, emotional, and spiritual needs. I want to share about one client we have in our center. I'll call her Anne. She came to us when she was starting her second trimester. Her the father of the baby left her, wasn't in her life anymore, she didn't think she had a choice. She thought her only choice was to have an abortion. When we let her know what we could do to support her, she did indeed choose to keep her baby. He's now 9 months old and he's thriving, and it is joy to see that, and it is an honor to see that. Every week, Anne comes in for parenting classes, and sometimes she'll just come in to hang out and need support. We've also helped her find a job. We've helped her and taught her relationship classes and taught her how to have a better relationship. But so I'll just end there since I don't have my time. Just wanted to say one more thing. I think that sometimes we think that we don't understand that what we do is a choice too. So sometimes we think someone who is in an unwanted pregnancy, their only choice is abortion, but we are the other choice. If they want to keep their baby, we can be of a support. And that's
Thank you very much for your testimony, Ms. Lungholm. Are there any questions? Seeing none,
Thank you very much.
The chair is going to call Emily Dye. You can bring her up with you. Oh, okay. Let me know when you're ready.
Sure. Okay. Yeah, my name is Emily Dye, and I'm from Stratham, New Hampshire. And today I'm here, well, first I want to address dear Honorable Senator Sharon Carson and the New Hampshire Senate members. Thank you for allowing me to share my concern and my opposition to Bill HB 224. I'm currently a stay-at-home mom, and I have an advanced Master's of Science degree in Christian counseling from Cairn University. I had volunteered at a crisis pregnancy center for 10 years. So I have a personal testimony that I would also like to share with you. Is it okay if I read a little bit? Because it's like personal.
Yeah,
so
just be
it's emotional.
cognizant of
Okay,
the
sure.
time.
Yeah, in 1995, when I was a senior in high school, I found out that I was pregnant. I decided, because of the shame of being an unwed mother and wanting to achieve more life goals, that abortion was the answer. After being turned away, and walking away from 2 abortion clinics, one in New Jersey and one in New York, I ended up at the Planned Parenthood, formerly Margaret Sanger Center in New York City. I was scheduled for a late-term abortion procedure. I was told to go home, pack a suitcase, that I would be staying at Howard Johnson in New York City for 3 days so that they could insert the laminaria, which would dilate my cervix for the partial birth abortion procedure. By God's mercy and grace on my life and my unborn child's life, I'm here to tell you, and also because I believe in the power of prayer, God answered my mom's prayer and a prayer chain she had going at her church. As I had begun unpacking my suitcase, I was stopped, and I believe that God unveiled my eyes and unhardened my heart to what I was about to partake in, which would have been the horrific and brutal murder of my unborn child. That day, God spoke to my heart that I was carrying a precious child, not a problem. Not a problem I had to get rid of. My mom heard my wails of relief from down the hall in my childhood home as I cried audibly in my bedroom. I ran to her as she called out to me, "God has a good plan and purpose for your baby." I went on to make an open adoption placement, and my parents and I have had photos and videos and visitation with my son. Today, my son is a grown man. He is in his late 20s, and we text each other weekly and see each other on special occasions. I can't imagine the horror and trauma if I had gone through with a late-term abortion. I can't imagine life without my precious son. Later on, I went to college and I was working on my counseling degree and doing internship at a local faith-based crisis pregnancy center. And I have to say, in my 10 years' time, I saw women who presented with post-abortion stress syndrome, and not one of them was happy that they had had an abortion. And so abortion does impact women with PASS. And so I strongly believe HB 224 should be opposed. Do I have any more time or wrap it up?
Yeah, just kind of wrap it up.
Okay, so yeah, I just believe the bill will lead to countless unborn children and born children through partial birth abortion procedures being aborted after 24 weeks. And babies feel pain around 15 weeks, according to Charlotte Lozier Institute. And so I believe that, this bill should not be approved. Thank you.
Thank you very much for your testimony. Are there any questions from the committee?
Sorry,
Seeing
can I pass
none.
these out too?
Yes, you can hand them to our aides and we'll make sure that we get them. Thank you. The chair will call Harold Guptill. Good afternoon, Mr. Guptill.
Good afternoon.
When you're all set, let me know and we'll get the timer started.
Yes. Good afternoon, Madam Chair and members of the committee. Thank you for hearing my testimony. Thank you for your patience on this very long day. My name is Harold Guptill. I am pastor at Tri-City Covenant Church in Somersworth, and I am here to speak in opposition to House Bill 224. Removing the criminal and civil penalties of the Fetal Life Protection Act would render this law toothless and really worthless. I assure you that the most holy God cares about each unborn baby. The first words of Holy Scripture are, "In the beginning, God created the heaven and the earth." The very personal God brought all things into existence. And on the sixth day, he did the pinnacle of his created works when he created humankind, male and female. We are his special creation because we are created in his image. Each life, therefore, is precious in his sight, whether born or unborn. As a minister of God, I must stand fast on the truth that each life is precious to him because he or she is created in his image. And as a minister of God, I would ask you all to stand fast on that truth as well with me. Additionally, as a father of 5 adopted children, I can further tell you that life is precious. My wife and I were not able to have children naturally, but we were able to adopt 5 precious children. It pains me to think that for a moment that one of them or all of them could have been taken through an abortion procedure. Further, as a human being, when I look at a current day ultrasound picture, especially of those of 24 weeks or more, I'm surprised that anybody can conclude that that is not a baby that's growing in its mother's womb. In closing, as a minister of the Holy Scriptures, I must also tell you that taking the life of another human being, whether born or unborn, has consequences, eternal consequences. If the penalties are removed from the Fetal Life Protection Act for performing abortions over 24 weeks, indeed, they will have consequences, and we would be telling abortion providers that there are no consequences. And honestly, that would be a lie. I ask you, therefore, to recommend inexpedient to legislate House Bill 224. I do thank you for your attention, and I do thank you for your service to our great state. I'm willing to take any questions the committee might have of me.
Thank you very much for your testimony, Mr. Guptill. Are there any questions from the committee?
Very good.
Seeing none, thank you.
You're welcome.
The chair will call Richard Ledgy?
Clegg.
Oh, Richard Clegg, I wasn't sure. Please come forward.
Apologize, Madam Chair. My only C in primary school was in handwriting.
Let me know when you're ready to get started and I'll start the timer.
I'm ready. Well, thank you, Madam Chair and committee. I appreciate your patience and long suffering. I had the privilege of being able to walk the halls while you've been sitting here all afternoon. So I live in Manchester. I serve as pastor of Faith Bridge Church in Manchester and also the New Hampshire Regional Coordinator for the Baptist Churches of New England. So I'm philosophically, theologically, and I'd like to think rationally pro-life. Our church is involved in foster care and working with women in crisis situations. My daughter, even after we have fostered 30 kids and have adopted 5, wants to be a caseworker and is studying to be a social worker this fall, beginning studies there. But I'd like to focus on the enforcement aspect. Some of you might have been around in 2009 when we had the housing crisis, and through that there was a problem, especially in Manchester, of dilapidated and neglected properties. And so there was a bill that was passed, RSA 541B, that required agents to register in state so that towns could serve them for having delinquent properties. And the bill was passed, and then shortly thereafter, the enforcement mechanism was repealed. And there was two people that benefited from the repeal of that enforcement mechanism. One was those who sought its repeal, which was primarily the banks and larger landlords, not so much that they were against it on its merits, but were afraid of the legal risk that they would be subjected to. And so they agreed to the law, they just were afraid of the legal risk and preferred the penalties be removed. Then there was another group that benefited, and that was the very law that the law was written against, as those who would abuse it. And so because they benefited from actual no legal recourse of breaking the law, they continued to break the law and violated the nature of the statute. And to sum and share, we have no idea the nature and number and circumstances of any abortion that happens in our state because we don't track those things. And why I'm much appreciative of the Dartmouth. They've cared for my children literally hundreds of days over the years. I would disagree with them on this point of the legal risk they ensue because they have good doctors, they have good providers, and if they follow the law, they should have no concern of legal risk. And so it's my recommendation to oppose 224 because a law with no penalty of recourse of breaking the law is no law at all.
Thank you very much for your testimony this afternoon. Are there any questions from the committee? Seeing none, thank you.
Thank you.
The chair will call, it looks like Jason Sa? Okay, come on forward.
Thank you.
Let me know when you're ready.
I'm ready, thank you.
Okay.
Good afternoon, Madam Chair, members of the committee. I'm here to present my opposition to Bill HB 224. My name is Juan Sa, pastor at Lifeway Church, there in New Hampshire for almost 20 years. I want to show you quickly a picture of my grandson. He's Danny. He's going to be 5 in June. And he's smart. He's lively, he's tender, he loves people, he loves to care for people, and he loves animals. When he was living inside my oldest daughter's womb, it wasn't as pretty as it is right now. And as I was preparing my testimony, I could remember how difficult it was for her, for us as a family. It was probably one of the hardest times. She texted me while I waited on the hall. I had prepared something, but I felt compelled to just read what she shared from her heart. My name is Emily Sa. I'm 25 years old. I'm blessed to be raising my 4-year-old son who will turn 5 in June, 2 days after my birthday. In November of 2017, I found myself in a low, dark valley in what was the worst relationship I've ever been. It was a scary and abusive relationship, as many naive young girls may find themselves in today. I was lost, confused, and scared of my future. All I had was my high school diploma. How would I survive? Precisely in these moments of utter darkness, I found myself holding a positive pregnancy test in my shaking hands. How could this be? A dangerous gang member is the father of my first child. This just could not be. I was not ready. I still felt like a little girl. And I was so broken with no self-worth or strength to pick up myself from the floor. Nonetheless, there was a life, a human life inside of me, and it was growing inside of me. I was gripped by anxiety and fears as I know what this meant for me, a life of being abused and controlled by a man who would now, in his eyes, own me. I wrestled with every option. I was alone. I could not bear bringing a child into this world with what I knew awaited him: poverty, violence, a drug environment, abuse, a traumatic pain. Deeply depressed, I decided in my head that this could not happen and that I would go forward with ending the beautiful life within me. I secretly went to a clinic
to get some help, and to my surprise, I was read a verse from Psalm 139. For you created my inmost being. You knit me together in my mother's womb. I praise you because I'm fearfully and wonderfully made. Your works are wonderful. I know full well your eyes saw my unformed body. All the days ordained for me were written in your book. None of them have passed. Today, this baby has been a source of healing for my heart and a source of joy for my family. I want to share my final words today. The motto of our great state, live free or die, also applies to these precious little boys and girls. If Danny would be standing here today, I know that nobody would be able to look into his eyes and say to him, you know what, buddy? We're about to pass a law that's not going to protect you, and we're going to make sure that people like you will never make it in this earth. We're all born here because nobody took our lives, and we thank God for that. I pray and plead for the conscience of our governor, our senators, that we leave a legacy of life in the state of New Hampshire, that we leave a good legacy that will be an example to the nation, that we are a compassionate state, and that we stand by the mothers and the families that go through horrible situations when they don't want their child. Thank you so much.
Thank you very much for your testimony this afternoon. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The chair will call Brian Johnson. Good afternoon, Mr. Johnson. Let me know when you're ready to go.
Okay. Good afternoon, Madam Senator and members of the committee. My name is Brian Johnson, pastor of Countryside Community Church in Hopkinton, New Hampshire. My wife and I have fostered a little over 40 children in the last 10 years or so. We've adopted 4 of them. I am here to oppose HB 224. I am very concerned that the notion that we would enact a bill and then remove all the enforcement of that bill, it moves it from a law to a recommendation. As a foster parent, I am deeply concerned as to what might happen to the rest of the laws of the state of New Hampshire if we were to say, make a law that said we could not abuse or neglect children in our great state, and then remove all of the enforcement behind that law. Where would my 4 daughters be at this point in time? And so that is of grave concern to me. I've been a bit disappointed by some of the medical practitioners who have argued in support of HB 224. I come from a medical family. My dad was an Army doc. He served among the world's poorest, where I grew up over in West Africa, went on to become the Director of Medical Services at Princeton University. My mom was a neonatal nurse at Buffalo Children's Hospital, and my daughter currently has followed in her footsteps and serves in the ICN up at Dartmouth Hitchcock in Lebanon, where she is helping to save the lives of 25-weekers and is very thrilled to be able to see life progress and flourish. And so I wish that there would be more time spent discussing the lives of these children who, if given the opportunity, can in fact live in our medical facilities that we have. My dad, as a doctor, as a physician, has always been fully aware of the legal ramifications for his actions or inactions in various activities. And this is no different of a situation at this point in time. I know that some have said we won't have medical providers come to this state if we have criminalization laws. Well, we already have criminalization laws against other sorts of activities and actions that doctors may or may not perform. And so in this case, the Fetal Life Protection Act already allows for and makes space for doctors to make good, lively decisions for their patients, both the mother and the baby. And so there should be no need for concern over that matter. And yet that has become a major talking point in this situation, which I think is irrelevant given the wording of the Fetal Protection Act that we have. And so I would urge you, please, to disregard the HB 224 and vote against it. I'm open to any questions, but thank you for your time.
Thank you very much for your testimony, Mr. Johnson. Are there any questions? Seeing none, thank you.
Thank you.
The chair will call Fran Burke. Let me know when you're
All set.
ready.
Madam Chair, members of the committee, my name is Fran Burke. I live in Nottingham, and I serve as a permanent deacon in St. Marie's Parish in West Manchester, New Hampshire. I'm here to oppose HB 224 as a return to open, unpenalized death of children, viable children. As a deacon, a spiritual director, a retreat leader, I have encountered many, many hundreds of people dealing with these issues. None of them have been sent away in judgment. All of them have been helped either with counseling, spiritual direction, support for children, support for the mothers. That's what our church does, and in a big way. Because we believe in the dignity of each and every human person. And we also know that looking back at history, when we deny that dignity to the least of our brothers and sisters, that it will be denied to the rest of us. It's just a matter of time. Today, I actually encountered one of our parishioners out there who was out there praying for all of you. And we prayed for all of you before we came. She was having a very difficult time explaining to her 7-year-old daughter today why she was coming down here. How do you explain to a 7-year-old child that a viable baby will be without penalty killed? And she was very troubled with this situation. We talked it through, and she's working on a plan with her husband on how you deal with that. If you can't talk to a 7-year-old about it, what are we doing? I oppose this bill and any other bills that continue to allow children who are wanted by others. As a father, I know that children change us. You cannot anticipate what is going to happen when you have a child or a grandchild as a father and a grandfather. No one can. Making a decision on the future and taking a life has lifelong consequences for the mental health of the people who do it. I oppose HB 224 and will take any questions if there are any.
Thank you very much for your testimony, Mr. Burke. Are there any questions from the committee? Seeing none, thank you.
Thank you, Madam Chair.
Okay, the chair will call, is it Donna Peterson?
So first of all, I want to thank you very much, Madam Chair and members of the Judiciary Committee, for hearing my testimony. So the first point that I'd like to make, I believe I'm opposed to HB 224, and I'm going to give you my points why. So my first point would be that it's unconstitutional because according to our Constitution, every person is granted the right to life, liberty, and the pursuit of happiness. Now, the Constitution does not define when life begins. We know biologically that life begins at conception. And so that person should be protected and be given life as well, and their life should be protected. So it's a very dangerous precedent for our state, for a nation, to decide legislatively who gets to die. They said, I remember back in '73 when Roe v. Wade was passed, and we had discussions at my Catholic high school where I went in an ethics class. And I remember them saying that this is going to lead us down the path where vulnerable citizens that are born are also going to be at risk. Disabled people are going to be at risk, and elderly people are going to be at risk. And we then go and see the Terry Schiavo case, where we have this disabled woman, and her husband did not want to be responsible for her anymore. He had moved on from her. And her parents were very willing to support her medically, to make sure that she got fed, she got proper care. They were going to pay for it, they were going to do it. But before she had gone ill, her husband had been designated as her healthcare proxy. So he decided, no, we're going to withdraw food from her and we're going to just let her go. Now, in Canada, they've actually gotten to the point where they're actually euthanizing elderly people because it's too hard on their healthcare system to care for so many people. I know people that are friends of those who live there, and they will tell this elderly person in the nursing home or assisted living, so-and-so, Rose or whatever your name is, I have your pain pill here, and it will be a euthanization pill. So in other nations, we also, so then you ask, well, why are young women who have unwanted pregnancies, why are they being encouraged to abort? Or, why does a culture encourage them to? And when there are so many, as has been stated already, there are so many crisis pregnancy centers that will provide support to the mother and the baby. They'll give them the baby's clothing and baby supplies. They'll help with the educational support of the mother and job training and all of that. Then why are we doing this? Well, the abortion industry is big business. They sell the fetal tissue for medical research, for drugs, etc. So there's a monetary situation here. But I just want to add as one final point. So the 40 Days for Life that is headed up by Sean Carney, on April 1st in their email, they posted a disturbing trend around the country, and that was that they're seeing more and more ambulances pulling up in front of the Planned Parenthood clinics, taking women away because they have complications in their abortion procedure. And so they're seeing this trend. And as has been stated in New Hampshire, we don't have data. They don't collect data on mortality or, botched abortions or any of that. So I just want to strongly encourage you to vote ITL and expedient to legislate for HB 224. And I thank you very much for your time.
Thank you very much for your testimony. Are there any questions? Seeing none, thank you. The chair will call Catherine Tucker.
Good afternoon, Madam Chair.
Okay, hold on, let me just pull up the timer. And when you're ready, let me know.
I'm ready. So I ask that you support this bill. I come to you with my background as a fertility lawyer, but I also have a decade of experience as a criminal prosecutor. And I'm here because I want you to support this bill so that babies can be born. We, the fertility community, we need OBGYNs, and we need good qualified OBGYNs. We are extra nervous patients, so we really, really need the best here in New Hampshire for us. So with regards to OBGYNs, the same folks that are providing abortions later in pregnancy, we also see them providing a lot of fertility care. Sometimes they provide the fertility care directly to the patients. Another significant portion is with fertility care that is provided in conjunction with a fertility specialist. And then, of course, every successful pregnancy is going to require prenatal care from, typically, that's going to be from an OBGYN. The infertility community really needs these qualified OBGYNs here in New Hampshire so that we can have the pregnancies that we desperately want to have. Now, I want to tell you a story about a friend of mine. She was my IVF cycle buddy, and she got pregnant. I didn't. We were so excited. She wanted this baby so much. And then we found out late in the pregnancy that her baby had no brain. That baby had no chance of survival. It was absolutely devastating to her. It was devastating to me. Our whole group was absolutely devastated. Fortunately, she was able to obtain a termination later in pregnancy. But one thing that stuck out for me about that is that there was no opportunity for this was 15 years ago, so there's no opportunity for judges and juries and prosecutors to second guess the doctor's decision there. And we shouldn't be allowing that second guessing. That just drives a wedge between doctors and their patients. And we shouldn't delays so that the doctor can consult with a lawyer. That should never happen. I'm a lawyer. I went to law school. I didn't go to medical school. I don't know what the medical considerations are in a late in pregnancy abortion. And it just astounds me that a doctor would have to come and seek my opinion before they can go ahead and perform a medical procedure. Another thing that I find very terrifying about the current statute is the civil penalties that allow the husband of the patient to bring his own action against the doctor. When I saw that initially, my first thought was, what a terrific way for an abusive husband to continue to try to control his wife. Absolutely, just it can cause so many problems for her, drive a wedge between a woman and her doctor. It just isn't, these civil and criminal penalties in the bill are not necessary. They don't have a place. They don't have a positive effect on the fertility community. And that's why I'm asking that you support this bill and I'm done.
I do have a question. That was good. Thank you very much. I appreciate we appreciate your testimony. Senator Whitley has a question.
Thank you, Madam Chair. So actually, you're the first person who's even spoken about the civil remedies, which is helpful because we've heard a lot of testimony about the criminal penalties. So have you taken a look at the civil penalty section? So I think the way that I read it, I'm a little concerned that these civil remedies, that it would allow someone to seek that from the mother. And so I'm wondering if you read it in a similar way, that they would be able to seek, this from the doctor who conducted the abortion, but also against the mother. So the father, the grandparent would be able to go after the mother if she sought an abortion. Is that how you read it?
I don't know. It's vague, it's ambiguous, it's really unclear. So that would be the kind of thing that, I would have to say, I don't know. And if I were advising a client, I'd have to tell them, you have to take the cautious approach here because these are the potential things that could happen if you take these actions.
Thank you.
Okay, are there any further questions? Oh, Senator Chandley.
Thank you very much. My question is similar. As I read the civil, and I asked this of someone not in the hearing, but I was trying to understand this earlier, under the civil penalties, if a woman is under 18, is it then possible that the physician could be a suit could be brought against the physician by both the husband and father, as well as the grandparents or the woman's mother and father?
Yes, absolutely. That's right here in the statute. It says that absolutely can happen.
So there could be more than one suit resulting. Thank you.
Okay, are there any further questions? Seeing none, thank you.
Thank you.
The chair will call Autumn Houle. Ms. Houle?
Oh, it's for a different bill.
Oh, okay. We're gonna call Neil Stanford. Okay. All right, we're gonna move on to the last page. The chair will call Kurt Welper. Let me know when you're ready, and we will
Ready?
timer going.
Thank you, Madam Chair. Members of the committee, I fully sympathize with your day.
We're used to this kind of a day with Judiciary. We get all the fun bills.
I identify. So just for the record, I'm a former pro-life activist, former state rep, and current pro-life activist. I live in Stratford, and I'm here to ask you to keep 6 House Bill 224. The first thing, I wasn't going to do this, but due to the question was just asked in the testimony, I want to say only one action can be brought against a defendant, I would think, for the same action. I don't think 10 people could do it, or 5 or whatever, but I'm not a lawyer. That's where I am. From the beginning, this bill has been and is an attempt to protect the lives of viable preborn babies. There's a lot of talk about, and the penalties are in there because we believe the penalty should fit the crime. And if the crime is the death of another human being, then maybe this bill belongs in the homicide statutes, where if a third party kills such a baby, he's subject to homicide under other circumstances. Only in this circumstance, where it's done by a medical professional, is the medical professional and the mother protected from criminal prosecution. The penalties in the homicide statutes are more severe than the ones in this bill. Because in our homicide statutes, we recognize the supreme value of human life. To remove those penalties is essentially to say that the deaths of these babies is trivial. It's not worth talking about. No big deal. So we have a law that says if you kill a baby for not good reason, you're subject to these being charged and tried for these penalties. With these penalties, seems to me that's perfectly reasonable. So that's the biggest thing I actually have to say, because I'm sure a lot of other things I might say you've already heard 10 times today. So I think I'll conclude with that. Or maybe I'll just say one more thing. I was talking to somebody else in the hallway, a colleague of yours, and asked him about this particular bill. And he said, that's like giving a license to kill. Done.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much. Next, the chair will call Ian Hewitt.
Thank you, Madam Chair, members of the committee. Ian Hewitt appearing for Cornerstone. Before 2021, there were felony penalties for 6-month abortions in the frighteningly far-right state of Massachusetts. There is no actual evidence that that ever deterred legitimate medical care or caused any women to be denied needed medical care. And if there was any such evidence, then the proponents of this bill would have brought it to this committee. The maternal health exception in this law is the same maternal health exception in our parental notification law, RSA 132.32, which has been on the books in New Hampshire for 10 years. There is no evidence that that has ever caused any woman to be denied needed medical care. That is, by the way, one of at least 2 other laws besides this one where there are criminal penalties for healthcare providers specifically. The General Court last year added an exception to our law for cases where the child is not going to survive outside the womb, and that apparently was not enough. There is, if someone decides at 6 months that they don't wish to be a parent, a safe haven law in New Hampshire that allows you to drop off a child without consequences, and that is also apparently not enough. There is in this law, in 32948, a special medical board review the General Court put in this law to create added protections just for healthcare providers, and that's also not enough. And the only providers who are punished under this law is a provider who knows a child is 6 months or older, knows it is viable, knows that there is no medical emergency, and still deliberately puts it to death. And that apparently is still not enough. And this bill comes to you and says, none of that is enough, and it's not enough because the child must die. This law and this bill have cleared away all these other ambiguities around this issue and clearly shown the Senate that the issue here is life and life alone. And if the lives of real children were not actually in the hands of the Senate today, then this bill would not exist and we would not be here. I'd be happy to take any questions.
Thank you very much for your testimony. Mr. Hewitt, are there any questions from the committee?
Thank you,
Mr.
Madam
Hewitt,
Chair.
I have a question for you. We just had testimony that under civil penalties, there's a long list of people, the father of the child, the father of the woman, grandparents can sue her. Is that how you interpret the current law?
I agreed with everything you said until you said her. The father, the grandparents, unless they consented or contributed to the abortion, and the woman can all sue the provider. That civil penalties section is 329.47. It makes clear it is a civil remedy for a violation of that subdivision, the Fetal Life Protection Act. The entire subdivision, everything in the Fetal Life Protection Act is about the behavior of healthcare providers. There's nothing there that even indirectly refers to any behavior by the woman. That would also be an absurd construction, which is precluded under just standard canons of statutory interpretation.
Thank you very much for the clarification. Senator Whitley?
Thank you, and thank you for taking my question. So, my understanding of statutory construction is you got to read the plain language. So can you point out in the plain language of that statute where it says it only applies to providers in that civil remedies?
Yes, in Roman numeral 2 in 47, it says that the civil remedies are for a violation of the subdivision, and the subdivision only talks about the behavior of providers. There's no even indirect references anywhere in the subdivision to the behavior of women.
Thank you.
Okay. Are there any further questions or comments? Okay, seeing none, thank you very much for your testimony. Okay, next we're going to call Jason Hennessy.
I just want to say you guys are really earning your $100 per year. I mean, you've gone out above and beyond.
Let me know when you're ready.
Hi, my name is Jason Hennessy. I'm here to represent the many pro-life people in New Hampshire as the president of New Hampshire Right to Life, the largest single-issue pro-life group in New Hampshire. I'm not a medical doctor, but I do have a doctorate in computational sciences and statistics, and I'll be talking a little bit about the research later. So many of you will know the story of the baby in Manchester that was a late Christmas surprise. This past year, a unexpected bundle of joy happened to land in a tent encampment in Manchester and was born in the middle of the night. He thankfully someone overheard his cries and called the police, and the police and other first responders spent over an hour searching for him. Eventually they found him laying uncovered in 15-degree weather on the ground. And thankfully, as far as I know, he was rescued. He's brought to the hospital, flown to Dartmouth, and is, as far from the news reports I've read, is doing great. But the question I want to ask you is, what would happen just a week before if you passed HB 224? I mean, the first responders heroically, they put in so much effort to rescue him. But if HB 224 passes, that baby who had all the rights and protections that we enjoy would not have had any of those. He could have been aborted for any and every reason. I want to talk a little bit about the penalties, because I've heard that discussed here. So make no mistake, removing the penalties is a repeal of the FLPA. The FLPA does not single out doctors, but punishes for intentional killing. It does not single out doctors because physicians actually have an exception to the fetal homicide bill, which would normally cover preborn babies. And this is RSA 630:1A. The FLPA simply closes that gap. In terms of the Board of Medicine disciplining, I haven't heard one example of the Board of Medicine disciplining on an issue like this. And where else is intentionally killing a person who's protected by the law privatized or outside of the Department of Justice? The Board of Medicine does not have subpoena power, does not have police, does not have a well-funded Attorney General's office. And how would people report it? And how would you avoid retaliation for the people who reported it? I want to address the doctor shortage comments that I've heard. I hit the literature, and I found two studies that were here.
Please just continue that
Okay.
last thought, please.
Thank you. So I want to address these. There's a 2015 study that studied challenges to rural care. The top issues, and I'll be sending this in as part of my written testimony. The top issues that they found for staffing rural obstetric care were scheduling OB nurses. The second one was training, and it had a lot to do with the fact that there are too few births. New Hampshire has the lowest birth rates, and whether our abortion laws, whether we repeal our abortion laws or not, are not going to affect that. The fact is, more babies means we'll have more practitioners. Less babies means less. The second study I wanted to talk about was the Guttmacher 2018 study, which Guttmacher is a pro-choice research group. And what they found was that only 7% of OB-GYNs had even done one abortion in the prior 2 years for when they had this study. So that means that the vast majority of OB-GYNs do not do abortions. This is a very tiny minority. And if we want to talk about anecdotes, I can actually refer to somebody I know who graduated from Dartmouth Medical School, who, when I asked if she was considering doing residency here, she said no because of their stance on abortion. And if that's something that we want to address to attract residents, I would strongly recommend that we become a state, join the 47 states that have a healthcare conscience law. Thank you, Madam Chair.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none? Thank you very much.
Thank you.
The chair will call Leslie Burns. Good afternoon, Ms. Burns. Let me know when you're all set.
I'm ready. Thank you, Madam Chair, and the committee for listening and serving our state in long hours. I am Leslie Burns from Chesterfield, New Hampshire, here to speak in opposition of both House Bill 224 and 88. I wonder, what is the difference between right here and right here? In a state where all residents, or in the language of this bill, all individuals, enjoy the constitutional right to life, how can it be that one is protected and the other is not? How could the difference of 5 minutes and 5 inches strip an individual of human rights? I wonder how this can be constitutional or logical or humane. I love women. I am a woman. I volunteer to help women, supporting them to overcome trauma and abuse in difficult situations. And as many people have already spoken, I experienced my own crisis pregnancy where I was advised to abort. And I'm so grateful that I chose life and have now a wonderful son who's helping to engineer rockets for NASA, like those who are going to bring people to the moon. As a woman, I understand and sympathize with women who find themselves in challenging pregnancy situations, and I am glad that their health is protected in the laws that we currently have, as has been referenced. However, I don't believe that adding another innocent human victim is the best solution. When I think about that term, innocent human victims, I'm grateful that this legislative body, as well as our nation, does much to support innocent victims of famine or natural disasters, refugees from Afghanistan, and things like that. We do much to protect the abuse of children, and we should. We've heard about protecting cats, and a person can be penalized with a $100,000 fine and a year in jail for damaging an eagle egg. And that's great. But who is more innocent than an unborn child who has done absolutely nothing to add to the trouble or evil in this world, who has absolutely no control over their own situation and no ability to protect their own life? I ask you, I beg you, to not pass legislation that could allow innocent human lives to become victims of intentional killing without even having a chance to save themselves. Let's be logical. Let's be constitutional. Let's be humane. Let's be our best selves and protect innocent human life. Thank you so much.
Thank you very much for your testimony. Are there any questions from the committee?
Thank you.
Seeing none, thank you. The chair will call Carissa Burns. Let me know when you're ready.
All right. My name is Carissa Burns. I am 15 years old. I stand here today, on behalf of over 300 of my fellow students. I am in opposition to both of these bills because we shouldn't get to decide if others live or die. And decriminalizing making that decision is the first step to legalizing it. The fine print of these bills aside, your job as legislators is to reflect the interest of the people. Give these babies a few more hours, maybe even minutes, and they would be citizens. If they could vote, they would vote, "Don't kill me." As someone who cannot legally vote, I care very much that my legislators are acting in the interest of the whole state. In some ways, these children have it even worse off than the slaves did in the days of slavery. At least then, those people could live, could escape, could buy their freedom. At least they could advocate for themselves. At least they were considered 3/5 of a human. These babies are not considered people at all. We should know this is a problem when we are looking back at the abomination that was slavery and saying those people are better off than our youngest, most vulnerable now. These babies don't have a voice. They don't have an opportunity to fight back. They don't even know they're in danger. Again, your job is to act in the interest of the people. Given a few more hours, killing these babies would be murder, and there are penalties for that. But now we're saying if they're still in the womb, there's no penalty for killing them. That is a fine line to draw. We know what comes next. The line will get pushed back even further. What's the difference from the baby about to be born and the baby who is born? The air in their lungs? A new debate will spring up, and we'll decide whether it's okay to kill babies who've already been born. And I hope that's something we can all agree is wrong. Do deaf people still like living? What about blind babies? What about false diagnoses? Like my mom mentioned, my brother was falsely diagnosed with Down syndrome. I couldn't imagine life without my brother. We don't live in a world eugenicist enough that people with disabilities would rather be dead. I almost died when I was 8 from an asthma attack, which continued on and off until I was 10. Do I wish I didn't live? I think my presence here today evidences that I like living. At any rate, this isn't a decision parents can make for their children. I'd like to end with something my friend Mason Lightfoot sent me. He said, "You don't know if these babies would have found the cure for cancer or some other great thing. Just think of all the lives that might be saved because of what that baby could do. If you pass this bill, you might have just sentenced people to their deaths because you did not allow the baby to reach its potential, to kill or not to kill. That is the question. Do you really want to give more opportunity to the road that leads to death?" Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much. Okay, thank you all for all your patience. We got through 10 pages of individuals that wanted to speak, had signed up to speak. Are there any members of the public that would like to speak to House Bill 224 before we conclude the hearing? Yes, ma'am, please come forward and identify yourself for the record.
Hi, I'm Dr. Mary Pearson, and apparently somebody couldn't read my writing, which is not surprising for a physician. Are you ready?
Yeah, we
Thank
sure
you. All right. I'm a board certified family practice doctor. I've been caring for women and children for over 30 years, and I concur with the testimonies of Dr. Michaud, Dr. Bergeron, and Dr. Johnson in opposing HB 224. I want to bring up a couple points I haven't heard anybody else share in the several hours of testimony that you've heard. The first is that I heard some testimony that there's no abortions for normal pregnancies. In fact, we don't have an abortion registry in this state, but Kaiser Permanente and Dr. Kimport, who are not pro-life, state that the majority of women who have third trimester abortions, in fact, are doing so for non-medical reasons. Secondly, termination is not an emergency procedure. Termination is an intentional choice. It's not something that happens as an emergency decision. It can happen because of new information. Lastly, I want to address the concerns about chemotherapy and immunotherapy in the third trimester. If you look at most of the websites of facilities that provide chemotherapy and immunotherapy for pregnant women, you will see that they are talking to women who are diagnosed with cancer during pregnancy, and they are pleading with them not to defer treatment, that they are urging them to have treatment because there's a good deal of evidence that having chemotherapy in your third trimester is actually better and safer for both mom and fetus, that many of the children that receive chemotherapy while in the womb do fine. And immunotherapy, which is a great new measure for cancer treatment, a lot of those women seem to be doing fine in our pregnancy registries. So while I do think it would be helpful to have an abortion registry so we can actually keep track of data, the evidence that's out there is not that these are medically driven procedures. So I oppose HB 224. These are viable pregnancies. There's no reason we shouldn't be doing Cs on these women. We should be doing C-sections and not abortions. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you.
Thank you.
Sir, please come forward and identify yourself for the record.
Thank you so much.
Um,
My name is Tim Versolano. I had signed on the list earlier. I'm not quite too sure what happened. It's been a long day.
It's been a long day.
Indeed. First off, I want to say, honorable members of the Senate Judiciary Committee, thank you so much for taking so much of your time to hear on this important matter. 26 years ago, I experienced the wonder and miracle of human life in my wife's belly with when I felt my daughter, my unborn daughter, for the first time move. Last Wednesday, I experienced that same wonder and miracle in almost 26 years with my daughter getting ready to give my wife and I our first grandchild. And it is a wonder indeed. Like I said a moment ago, my name is Tim Versolano, and I'm the lead pastor of Real Life Church in Laconia. The church that I pastor is part of a larger family of tens of thousands of Foursquare churches with millions of members around the country and the world who believe all human life is valuable and precious according to God's word. As a minister of the great news that God gives and the preciousness of human life, I'm here today to oppose HB 224. Why? Because for over 30 years, I have ministered to a number of women who have believed the lie that abortion can empower them and make their lives better. However, the trauma that I have seen that has come from the removal of the life in the womb permanently impaired them at the deepest levels inside themselves. A study published recently in the Journal of American Physicians and Surgeons found that nearly 3/4 of the women with a history of abortion, which was 73.8% of the survey that was done, admitted that they experienced at least subtle forms of pressure to terminate their pregnancies. This study shows in a society that is rightly engaged in the leveling up of women, abortion produces the exact opposite response by introducing years of unnecessary hurt, deep depression, anger, suicidal ideations, and much more trauma into their lives. When we as a society support, promote, and endorse abortion, we are impairing, even literally killing, the legacy that women can leave to the generations that follow. The killing of preborn humans who have not yet realized their God-given right to use their voices, a right that is in fact protected by our First Amendment as American citizens, is not only immoral, but puts our country in the same category as those who make up the absolute worst in humanity. We are unashamedly selling a toxic cocktail that is lethal to the larger part of our society, to the women, whose potential is literally being aborted on the altar of whatever we choose to label it. The life transformational and most often free counseling services that churches and pregnancy care centers provides goes mostly unnoticed by the general public, but is not lost onto those whom it is given. Human life in the womb is formed in God's image, is endowed with the dignity of personhood, and thus deserves the same protection under civil law that any human outside of the womb enjoys. For these reasons, I ask you to please recommend an expedient to legislate for HB 224 and any other future proposal once and for all. Let's be better so we can do better and leave a better legacy to those generations that come behind us. Thank you so much for your service to us and to our state.
Thank you
Appreciate
very
it.
much for your testimony. I was going to say this afternoon, but it's more like this evening. Are there any questions from the committee? Seeing none, thank you very much.
Thank you so much.
Okay, last call. Is there anyone who would like to testify who has not had the opportunity to testify on House Bill 224? Okay, seeing none, I'm going to close the public hearing. The committee is going to be in recess until 5:45. Our staff need to have some dinner. So appreciate it, and we will see you at 5:45.
Thank you, Senator. I appreciate it. I hope you won't mind as I introduce this bill. I will read some. It has been a long day and I don't want to forget anything that I have prepared, so apologies ahead of time. Good evening. I guess we're evening. Good evening, members of Senate Judiciary. It's an honor for me to introduce HB 88, the Access to Abortion Care Act. I'm also proud to share with you that it passed the House last week in a bipartisan vote. New Hampshire is one of 3 states where abortion is legal but not explicitly protected in state law. While Granite Staters can still have an abortion in New Hampshire up to 24 weeks, there's nothing on the books that recognizes that access or right. There's a legal void currently. The restrictions are explicitly stated in our law, but no language is used in the state's current abortion ban to establish a right to abortion before 24 weeks. Instead, RSA 32949 states, quote, "Nothing in this subdivision shall be construed as creating or recognizing a right to abortion," end quote. HB 88 should be a bill we can all agree on because it explicitly clarifies what is already in law. HB 88 clarifies that the state shall not interfere with an individual's access to abortion before the 24th week of a pregnancy. I'll talk a little bit about what the bill does and what the bill doesn't do. The bill does not change the 24-week ban at all. It does not change the parental notification law either. Instead, it puts into state law that the state can't further interfere in an individual's ability to access abortion. Right now, there's nothing in the law that grants Granite Staters rights. Current law only contains restrictions. I also want to be clear that this bill is not an endorsement of the current abortion ban. The co-sponsors of this bill all believe that the government should not come between a patient and a doctor in making private health care decisions. But with the ban that is on the books now, what we have before here is providing critical clarity to the law as it stands regarding abortion. We want and need to take action immediately to add explicit protections for all Granite Staters before the 24-week mark. Because this bill does not change the current abortion ban, one could be a legislator who supports the abortion ban, and one could still vote to pass this bill because it adds clarifying protections for women to make their own decisions in the majority of situations. The Access to Abortion Care Act, HB 88, adds clarity on where we, the legislature, stand and what our intent is for abortion laws in New Hampshire. Indeed, perhaps this bill wasn't needed when there was a federal legal framework for abortion rights, but all that has changed with the overturning of Roe only 9 months ago. We have seen what has happened to abortion access in this country in those 9 months. We have an obligation to our constituents, the overwhelming majority of whom believe that decisions about reproductive and abortion care belong to pregnant people and the people who provide them care. Polling immediately after the election showed that a majority of Granite Staters want their state lawmakers to pass laws to protect abortion access. Our constituents see what is happening across this country. They see the state of Florida, who passed a 15-week abortion ban a little over a year ago, and are now on the cusp of passing a near total ban. They know that within the blink of an eye, their rights could be gone because at the federal level, they are not protected. We have nothing to point to in New Hampshire to assure them that it will be okay. Granite Staters are looking to us, their elected officials, right now to take action because we as a legislature and as a state have not done anything proactive since Roe v. Wade was overturned. Passing the Access to Abortion Care Act will show the people that we understand what's at stake and that we trust them and their doctors. I want to acknowledge also that I know you all have been here a very long time, so thank you for being patient and taking time to hear me speak, and I'm happy to answer any questions that you have.
Thank you very much for your testimony, Representative. Are there any questions from the committee? Senator Abbas.
Thank you, Madam Chair, and thank you for taking my question. You mentioned that New Hampshire has an abortion ban. Can you explain what you mean by the abortion ban?
Sure. So after 24 weeks, the rights to an abortion are restricted. Yes.
Yes. Follow up?
And a follow-up question. Is there, and this is more of a drafting issue, but rather than use the term individual, is there a reason why the language wouldn't specifically reference a woman as opposed to saying individual? Because all individuals would, I mean, that would apply to me.
Well, all women are individuals. So I think individuals includes.
It does, I agree.
Yeah, yeah.
So?
Follow-up. But I agree that all women are individuals, but what I'm saying as written, is the intent of this to apply to just women as opposed to every individual on the planet? Because I think, my point is, I don't believe it's the intent to apply to me, but I believe as written it does.
It applies to any individual who is pregnant. That's my intent as a sponsor.
Thank you.
Yeah.
Okay. Are there any further questions? Seeing none, thank you very much.
Thank you.
The next I have Representative Megan Murray. Okay, let me know when you're ready to go.
Sure.
Okay.
Thank you. Honorable colleagues of the Senate Judiciary Committee, for the record, I come before you in support of House Bill 88 as a co-sponsor, woman, and mother who represents the towns of Amherst and Milford, Hillsborough, District 37. In interest of time, I'll just say that last year, we know that a federally and constitutionally enshrined right was taken away from so many across the nation. Women and our allies have worked tirelessly towards equality on so many fronts, and to ensure that this is so, we must act now that the decision has turned to the states across America. This bill would provide legal strength in the right to abortion care. It changes none of the statute already set in law. HB 88 is, at a minimum, the least we can do to provide assurance to those seeking abortion care so that we can clearly and firmly commit to protecting safe, legal access to care. Those who are least able to afford care may have to travel many miles, leave their home states or their providers, or for fear of retribution, a provider could leave and practice elsewhere, leaving a void in reproductive health care options if we do not send a clear message that abortion care is protected in law here in New Hampshire. HB 88 ensures that access to abortion care, which is so vitally important, remains a private decision that families along with their medical providers make together. The reasons for an abortion are many and unique to each person, as there are, as are their medical and personal circumstances. We as a community must ensure that from an equity standpoint, we make a commitment to the most vulnerable population that access to care is a right that is safely and privately enshrined with the protection of the law firmly alongside those seeking abortion care. HB 88 bipartisanly seeks clarity and offers an opportunity for folks in New Hampshire from a wide variety of policy standpoints to support and affirm access to abortion care. I thank the Senate for listening and urge ought to pass on House Bill 88, and thank you for the commitment to quality, safe, and legal care that is set into statute.
Thank you very much for your testimony, Representative. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The crowd is quite thin, and a lot of folks had signed up. So what I'm going to do is just read the names, and if I call your name, come on up. Paul Galasso. Okay, Laura Elzem. Bob Dunn. No, he's not here. Margaret Gibbons. Okay. Roy Dennehy. Kathleen Guerin. Okay. Susan Gendron. Brian Harlow. Okay. Allison Bodell. Okay, William Courier. Liz Canada. Now, I know you're here. And it's because Liz has appeared in front of the committee before on a number of occasions.
I
So
thought I would win a
recognize
prize
Liz.
for being the first one called down. Price is right. All right.
So hold on, let me get when you're ready, let me know.
Sure, I'm all ready. Thank you.
Okay.
Good evening, and hello again, honorable members of the Senate Judiciary Committee. My name is Liz Canada. I'm the Advocacy Manager at Planned Parenthood New Hampshire Action Fund and Planned Parenthood of Northern New England. We are again here in support of the Access to Abortion Care Act, House Bill 88, because New Hampshire does not have any language in state law explicitly protecting an individual's ability to access abortion before 24 weeks. Now, we've heard that we already have this or that we don't need it, but I want to be clear that we do not have this. I want to offer some comparisons to other New England states for some clarity here. So I'm going to read directly from two of the states' state law. So for Rhode Island, their state law reads, quote, "Neither the state nor any of its agencies or political subdivisions shall restrict an individual person from preventing, commencing, continuing, or terminating that individual's pregnancy prior to fetal viability." That's Rhode Island's law. Maine's law reads, quote, "It is the public policy of the state that the state not restrict a woman's exercise of her private decision to terminate a pregnancy before viability, except as provided in section 1597-A. I have the other New England states here, and I'm happy to read them for you if you'd like, but my point is, here in New Hampshire, all we have is RSA 329:49. Nothing in this subdivision shall be construed as creating or recognizing a right to abortion. We don't have any other language in the abortion ban statute or anywhere else that explicitly states that an individual's ability to access abortion is protected. Yes, abortion in New Hampshire is legal, but it is not protected. House Bill 88 would add clarity to the language that's on the books. It would add language into our state law here in New Hampshire that the state cannot interfere in an individual's right to access abortion before 24 weeks, just like we see in state laws in New England and in other states in the country. So we urge you to vote ought to pass on House Bill 88. Thank you.
Thank you very much for your testimony, Ms. Canada. Are there any other questions?
Yes.
Yes, please.
Thank you, Madam Chair. Thank you for taking my question. So you may remember you were here. We had the identical bill,
yes.
SB 181. And I'm wondering, but that was several months ago. And, a lot of this is in reaction to what has happened at the federal level. And so I'm wondering, has there been any sort of changes to the federal landscape that would, you see, would necessitate us taking action?
Thank you for the question. Yes, I think we were here in January is when the hearing was on SB 181, and a lot has changed since then. Two come to mind immediately. So you've probably seen in the news already, Idaho is on track to put into effect criminalization of any individual who's
Sorry.
That's okay. To put into law criminalization to anyone who supports a minor accessing abortion care. Now, Idaho has completely banned abortion. Idaho does not have abortion in their state anymore. So the criminalization would happen for folks who are supporting a minor leaving the state and going somewhere else. So that is set, I think, to be sent to the governor's desk next week, something like that. So that's one thing that has changed in the country. The other one is Florida is a state where, and I'm going to do my best to get the timeline right. Before Roe fell, they had a 24-week abortion ban, which is similar to what we have here. Then last year they passed a 15-week ban. And now, I think also in the next week or two, they're sending a near total abortion ban to their governor, which is expected to be signed. So we see that things are happening in sort of rapid succession around the country, and I cannot speak to every single state, I can't do that, but those two definitely come to mind because they're in the media a lot, people are hearing about them a lot, and I know that Granite Staters are like, what are we gonna do? And so I think for House Bill 88, this is a really positive bill to set out to Granite Staters of this is what we're doing. We are not touching abortion again. We are going to make sure that it is protected before 24 weeks. We are offering that clarity. We're putting it into state law.
One follow-up.
Thank you. Thank you, Madam Chair. That's helpful. The other situation that has sort of been on my mind is the mifepristone case. And if you're familiar with it, that's the medication used for medication abortion. And so my concern has always been, now that we have these different technologies, abortion it can go across state lines. And so I'm wondering if you have any sense, about how that case may impact New Hampshire's need to have something on the books.
Sure. Thank you for the question. Sorry to say just sure. Thank you for the question. So the mifepristone case, this case is going to potentially dramatically change what medication abortion looks like across the country. It doesn't matter what state you're in when this case comes out potentially. It is potentially going to stop medication abortion, at least the first pill of the 2-pill series. It is going to take it off. It could. The judge is going to rule at any time. He can rule at any time in the foreseeable future, as soon as maybe tomorrow, on this case. And so it will not matter what state you are in. Medication abortion could be drastically changed or banned completely. Now, Planned Parenthood of Northern New England and the other abortion providers are ready to take action if that were to happen. But the point is, cases that are happening at the national level, the federal level, can impact what's happening in New Hampshire. Now, I could see that that's just one case. There's something like 12 others that could impact New Hampshire. And so this type of legislation is helpful in setting the record straight of where we are in New Hampshire, of what we support. And the mifepristone case is just one. It will affect every single state potentially, no matter what. And still, this is an important bill to pass because it is about protecting abortion up until 24 weeks and providing those assurances to granted staters.
Last follow-up. Thank you, Madam Chair. Thank you for taking my another question. I apologize.
No.
So what I'm what I was getting at a little bit with the mifepristone question is that because abortion care can be done in the case of medication abortion, it could potentially be done via telehealth and via the mail. And so are we seeing states that are trying to impose their own abortion policy on other states?
Thank you for the question. There are certainly laws that are trying to be passed in other states to reach into New Hampshire. That is absolutely the case. I think, Idaho is not a direct reach into New Hampshire only, but is about across state lines. Like that is something that's happening. The Texas law that has the bounty hunter provision, that has not been struck down by the courts, and it would impact anyone in the country. I think I shared in January probably that last year Missouri tried to pass a law that would affect people traveling out of state and affecting patients and providers. So, that is definitely happening. States are able now to restrict abortion in all sorts of ways, and we're seeing that that's happening. And we don't even know what the future even holds in those types of bans or criminalization or the types of laws that are going to be passed. The flip side of that is that there are states that have moved swiftly to protect abortion access. There were states that support abortion access. And so when Roe was overturned, some amended their constitutions. I shared that in January, I believe. Some amended their constitutions. Some put into place shield laws. And shield laws are when you protect providers and or patients, both in your state or folks who are traveling to your state. Some had governors who issued executive orders. There were states that took swift action. So we see House Bill 88 as that action, as taking an action to say, we are not touching anything before 24 weeks. We believe that women should have the right to access abortion before 24 weeks. And so we are making it very clear in state law.
Thank you.
Are there any further questions? Senator Abbas.
Thank you, Madam Chair. Thank you for taking my question. Although the Fetal Life Protection Act doesn't expressly state that there's a right created, wouldn't the 14th Amendment, the Equal Protection Clause, allow equal protection of that law to be that any person or woman would be allowed to get an abortion under New Hampshire law? Because it's once you create the state law, then you have the Equal Protection Clause would apply to it, because that would apply to the states as well. So to me, the law is already there, even if it doesn't expressly state it.
Thanks for the question. I don't believe the court has ruled anything like that for abortion, so I don't think that would be the case here. I'm not a constitutional attorney. I couldn't speak to that, but I do not know of anything like that.
Follow up? Nope, you're all set. I have a question I'd like that really Senator Whitley caused me to really think about. Then you're talking about this medication where it is coming from a different state. And that, to me, qualifies as interstate commerce, not intrastate commerce. Has the federal government done anything to protect that type of commerce by passing legislation?
Thank you for the question. So the mifepristone case is, I am more than happy to send more details to you because I'm not going to speak well at 6:10, so I'm worried about that. But the case would impact it being available at all potentially. So the judge has not ruled yet. I will look into your question to make sure that I can answer it more appropriately and follow up with you tomorrow, if that's okay.
Terrific. Thank you. You have another question?
I do.
Hi,
It was
Senator
triggered.
Whitley. Okay.
I blame it on Senator Abbas, who went there with the constitutional. I was not going to go there, but isn't it true? I'm sure you have read the Dobbs decision or heard reporting that. Isn't it true that the core holding in Dobbs is that abortion, the right to abortion, is not a constitutional issue, is not an issue that the court should decide. They said specifically abortion and the right to regulate abortion is not something that the Supreme Court should be deciding. It's not a constitutional issue. It is specifically for the states to decide. In fact, Alito said specifically, our decision returns the issue of abortion to those legislative bodies, right? So would you agree that because the court was very, very clear that abortion is not a constitutional issue for the U.S. Supreme Court to decide that what the protection that Senator Abbas was referring to in the 14th Amendment wouldn't apply?
Yes, I'd agree with that.
Okay. All right. Are there any further questions? Seeing none. Thank you very much.
Thank
for
you.
your
I'll get you that
testimony.
tomorrow.
Yeah,
Thank you so
I
much.
look forward to
Yes.
reading that. I think it's a different way of looking at the issue, especially with the medication, because we have no control once it goes over state lines. That's the federal government. So,
Thanks,
okay,
Senator.
thank you. The chair will call Michaela Russell. And let me know when you're ready.
Hello, my name is Michaela Russell. I reside in Manchester, New Hampshire, and I oppose HB 88. I used to be pro-choice, but I am no longer because I was challenged to decide what gestational age I thought limits would be okay. And I was also asked to research how abortions were performed. Once I went through this process, I could no longer support pro-choice. Furthermore, later on, I ended up becoming a Christian. And God makes it even clearer now, abortion is wrong. Jeremiah chapter 7, verses 30 through 32. The people of Judah have done evil in my eyes, declares the Lord. They have set up their detestable idols in the house that bears my name and have defiled it. They have built high places of Topheth in the valley of Ben Hinnom to burn their sons and daughters in the fire, something I did not command, nor did it enter my mind. So beware, the days are coming, declares the Lord, when people will no longer call it Topheth or the valley of Ben Hinnom, but the valley of slaughter, for they will bury the dead in Topheth until there is no more room. In this passage of scripture, God's people have begun worshiping other gods and sacrificing their children. Abortion is modern-day child sacrifice. And what are we sacrificing these children towards? Trying to reach a desired life that we had planned for ourselves, trying to avoid increased hardship. I do not deny that women will face potentially more difficulties with an unplanned pregnancy. I just do not think that it justifies taking the life of innocence, of the unborn. Do we care for the mother's psychological and physical future when she comes to terms with the truth? What happens when complications of abortion prevent future pregnancies? Or what happens when she reconciles the guilt of what she has done in the past as she watches all the milestones while she is growing a new human life in her and realizes what she has done? What happens when she experiences increased anxiety, depression, and suicidal thoughts? Or she has miscarriages because past abortions increase that risk of miscarriage and preterm birth. I do not ignore, as I said, that unplanned pregnancy can dramatically redirect a woman's life. I just don't agree that those are reasons worth ending innocent life for. We should try to proactively protect abortion through, we should not try to proactively protect abortion through legislation. We should be doing the exact opposite and restricting abortion. I will end with Psalm 127:3. Behold, children are a heritage from the Lord. The fruit of the womb is a reward. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much.
Thank you.
The chair will call Dr. Young. Let me know when you're ready, Dr. Young.
Already. Long day for you folks. I really appreciate what you do for the state of New Hampshire. I mean that sincerely.
Thank you.
I think you remember I'm a retired OBGYN. Practiced 35 years in Concord, taught medical students for 40 years, past president of the New Hampshire Medical Society, and still serve on our general council representing the obstetricians of New Hampshire. I'm here testifying in support of HB 88 on behalf of New Hampshire Medical Society, the majority of my colleagues, my past patients, and the women of New Hampshire. I'll be very brief. Politics obviously crept into the judicial branch of our democracy last year when the Dobbs v. Jackson decision overturned Roe v. Wade. Taking away the right of privacy in deciding about a woman's health, her family, and her future. The result is that right now 1 in 3 women of reproductive age in our country may no longer access abortion in their home state. The inevitable result will be that affluent women will continue to have access to safe and affordable abortion across state lines if necessary. But marginalized and less affluent women will not have access to preventive services, and they will resort to unsafe abortions and suffer the consequences. There are not many of us left, but I'm old enough to have witnessed the consequences of illegal abortions performed by unskilled providers in non-sterile conditions. My first admission to our GYN service as an intern was a young woman with a septic abortion. We gave her fluids and antibiotics, took her to the operating room, and removed a foul-smelling, pus-filled uterus, tubes, and ovaries, and then helplessly watched her die 2 days later, leaving 3 motherless children at home. If my feelings about legalized abortion were ambivalent at that time, they never were after. The stark reality is that there will always be abortions. We cannot go back to desperate women of limited means seeking unsafe pregnancy terminations. We must protect the privacy of a woman and her care provider when it comes to pregnancy. The decision is deeply personal and a difficult one that should remain the prerogative of each woman and her provider, never to be usurped by lawmakers. I encourage you to join all the other New England states, Maine, Vermont, Connecticut, Massachusetts, Rhode Island, that have already codified abortion to protect a woman's right to terminate a pregnancy. We must make clear that New Hampshire is a state that values privacy, that values freedom, that values individual decision-making by passing House Bill 88. Thank you.
Thank you very much for your testimony. Are there any questions for the doctor? Seeing none, thank you very much. Okay, Robert Lacoste. Okay, I don't believe he's here. Okay, Tim Vercellino. Okay, Jake Berry. I believe Jake is here. Okay. Reverend Allison Palm. She has to leave? Okay. Courtney Reed. Anita, when you're ready.
Thank you so much, Senator Carson and members of the committee for taking so much time today to listen to testimony. My name is Courtney Reed, and I serve as policy advocate with the ACLU of New Hampshire, and I would like to provide a statement of support for House Bill 88, an important bill that would protect access to abortion through statute. I'm hoping that after seeing the House bill pass, that the committee will vote in favor of this legislation through an OTP motion. When I spoke to the Senate's companion bill, SB 181, I recounted how earlier this year we should have celebrated the 50th anniversary of Roe v. Wade, and instead we're now facing the ruling's devastating impacts on people and families across the country. And I mentioned how since Roe's overturn, 12 states have banned abortion outright, and as many as 1 in 3 women of reproductive age have lost access to abortion in their home state because, as we've discussed, now that Roe has been overturned, the legality of abortion is up to individual states. However, we know that New Hampshire has no state-level protective policies guaranteeing Granite Staters' rights to abortion or other reproductive health services. In fact, it's the only state in New England without protections in place for the right to have an abortion. And I mentioned all of this in my previous testimony, and all of it is still true today. But the committee has the ability to change the state of affairs in New Hampshire amidst a landscape nationwide of uncertainty and fear. And I'll also note that last time I was in committee, I recounted how attacks on abortion often come through paths of incrementalism, speaking to Texas, starting with a 24-week ban, which is where New Hampshire falls today, and that there will always be politicians eager to chip away at access to abortion, like we've seen in Texas. And I don't think we should pretend like this isn't happening here in New Hampshire, as we've seen numerous bills introduced this session attacking abortion rights. But I'd like to speak to a little bit more of a personal relationship to this bill, where I have a younger sister who attends college in another state without state-level protections to the right to abortion. And I can't imagine what she and other college-age students in states without protections, like New Hampshire, might be going through, whereas otherwise they wouldn't have to worry about these things if those states pass legislation like we're considering right now, HB 88. I think it's unconscionable that we wouldn't take this basic step to protect private healthcare decisions. And unfortunately, my concerns about my sister aren't unique. In fact, a majority of college students oppose the U.S. Supreme Court's decision overturning Roe v. Wade, and their desire to attend college in a state that legally protects the right to abortion is overwhelming. Legislators have the ability to bring relief to so many worried Granite Staters by deciding to vote in favor of protecting the right to abortion, and we know that 72% of polled Granite Staters identified as pro-choice in a 2022 poll. A vote for this legislation affirms to Granite Staters that they remain free to make important healthcare decisions, and in a state that supposedly respects autonomy and privacy, this is the bare minimum that we should be doing. In fact, 17 states and the District of Columbia have already taken actions to enshrine this right. And I just want to encourage the committee to pass this bill, as protecting abortion is part of a battle for racial equity, public safety, privacy, and so much more. Thank you.
Thank you very much for your testimony. Are there any questions for Ms. Reed? Senator Abbas?
Thank you.
Thank you, Madam Chair, and thank you for taking my question. I understand the logic of that if what happened in Texas and apparently what's happened in Florida as well, where it slowly keeps moving the needle in one direction. Regardless of the fate of HB 88, what would stop future legislators from doing the same in New Hampshire?
Right. So I think, like any law, HB 88 could be undone by a future legislature if it were to pass, if that's what you're speaking to. But I think that this legislation sends a really important message to constituents and an overwhelming majority of Granite Staters that we support and want to protect their access to abortion.
Follow up?
I just one follow-up.
Yeah.
Can I ask your understanding, would the Equal Protection Clause offer equal protection of the law? I'm talking about the 14th Amendment. Would that apply to any state law in New Hampshire? It would including any rights under or any laws under the Fetal Life Protection Act?
Yeah, I don't feel comfortable answering that question as I'm not a practicing attorney, but I can speak to our team and get back to you.
Thank you.
Thank you.
Are there any further questions? Seeing none, thank you
so
very
much
for your testimony. The chair will call Autumn Hool. So let me turn my phone on again.
Sure.
Are you ready to go?
I am ready.
Okay, terrific. There you go.
Hi, all. My name is Autumn, and I am the Patient and Outreach Coordinator at the Reproductive Freedom Fund of New Hampshire. We're an organization that works to ensure patients can access abortion through providing them funding for their procedure, rides to their appointment, and emotional support. I'm here to express my strong support for HB 88. As our organization deals with the fallout of half of our country banning abortion, there has never been a more important time for us to protect the right to abortion here in New Hampshire, which we know nearly 70% of Granite Staters support. Despite personal opinions on the topic, abortion is an incredibly safe medical procedure. Abortion pills are safer than Tylenol, and the residents of our state deserve to know that. Despite what the Supreme Court or other states may decide, Granite Staters should be guaranteed access to abortion up until 24 weeks. HB 88 wouldn't change anything about our existing law, but it would solidify it, giving Granite Staters a clear answer to where we stand. Personally, we've dealt with a lot of confusion around where current legislation stands with the patients we serve, so I know this bill would be a welcome solution for our patients. If we as Granite Staters truly believe in bodily autonomy, medical privacy, and the rights of Granite Staters to pursue liberty, we must pass this bill and affirm the rights of all into law, so we can then begin the true work of ensuring equal access and true reproductive justice. I urge you all to vote in favor, with the majority of Granite Staters saying they want the right to abortion to be protected here in New Hampshire, and I urge you to support this bill. Thank you.
Thank you very much. Are there any questions from Ms. Wool? Seeing none, thank you. Oh,
Thank you.
you do?
Yeah.
Okay.
Sorry.
Thank you, Madam Chair.
Senator Whitley has a question.
Thank you for taking my question. We heard before from Senator Abbas that, sort of this, argument, well, why would we do this if future legislatures can just undo it? But wouldn't you agree that, wouldn't it be better to protect patients like the ones that you serve right now from having that protection? Wouldn't it be better to have that now than not?
Yeah, one of the kind of biggest capacity takers is helping people understand what their options are in New Hampshire, what's legal, what's not legal. And I think that this bill would give Granite Staters a lot of clarity.
Okay. Senator Abbas.
Thank you, Madam Chair. So if I understand your answer, there's a lot of people confused about what their rights are or what the laws are in place are regarding abortion.
Right. So I think the landscape is changing nationally and also state by state, and our Granite Staters are confused when trying to access care.
Follow up.
And what kind of confusion are you running into? Just generally, a couple examples.
So we're having people contact our hotline looking for support, not sure if they can get an abortion here in New Hampshire. So enshrining that in HB 88 would lead to greater clarity for our patients.
Yes, follow up.
And I'm not asking any specific names, but do you know why people are calling in believing that they are not allowed to get an abortion or it's not legal in New Hampshire?
I think because information is changing very quickly, and it's state by state at this point, and people just aren't sure.
Thank you.
Are there any further questions? Seeing none, thank you very much for your testimony.
Thank you.
The chair will call Katrin Bergen. Okay. Dr. Mary Pearson. Okay. Devin Quinn. Okay. Just let me get this. Okay. Are you ready?
Yes. Madam Chair, members of the committee, my name is Devin Quinn. I'm the Director of Policy at the New Hampshire Women's Foundation, where we invest in equality and opportunity for the women and girls of the Granite State through research, education, advocacy, and grant making. And the New Hampshire Women's Foundation supports HB 88 because the people of New Hampshire are looking for clarification and assurance that New Hampshire does and will protect the right to an abortion before 24 weeks. As mentioned before, when Roe v. Wade fell last summer, we knew that people were going to want to share their expressions of rage and their confusion. They also were going to look for education and information, especially since this was coming to the States, and what was going on in New Hampshire. So we created this handout given to this committee before. This is our Gender Matters issue on the status of abortion in New Hampshire. It's really supposed to really just lay out the facts of the what is legal in New Hampshire, and particularly in relation to regionally in New England. And we always start, as we do here, with the fact that abortion is legal in New Hampshire till 24 weeks, with certain exceptions after that. Abortion is legal in New Hampshire up to 24 weeks. We say that all the time because it's so important for people to know that. But honestly, the more we talk to folks in various communities, we find out that people are still confused. And it's not anyone's fault that this is just a really complex landscape. They don't get news that's just from New Hampshire. They are consuming news nationally, and they know that this is changing. And honestly, people, particularly in New England and New Hampshire, live lives across state lines. You know, they might live in New Hampshire, have a job in Maine, send their kids to school in Massachusetts, have a doctor in Vermont, go to a hospital in New Hampshire. So that's a lot to keep track of, and which things apply to them when. So we have heard things like, you know, it's protected versus legal. What does that mean? Is that more legal somewhere else? Or is it, if it's protected, then does that mean I should go to a different state? Or what happens if I'm, you know, my daughter is traveling across state lines to come back home for care? And I've also heard this amongst doctors as well, particularly providers who do not have a specialty in obstetrics, particularly providers who are in rural areas and maybe don't have labor and delivery units. They don't have access to obstetrics as much. And they have a lot of questions around how that's going to interact with them as they sometimes are practicing in Vermont and New Hampshire. And so how are those laws different? So what we've learned is that people are really craving clarity and assurance. And I know that two things can be true at the same time, and that, you know, we can read the law and understand that something that's not illegal is legal, but that can be confusing also for other people. And I can, you know, have the privilege to understand how this law came to be here and what the intent was, but it can still be really confusing for the average person to understand. And clarification is a valuable tool that the legislature can offer the people of New Hampshire.
Okay, thank you very much for your testimony. Are there any questions? Senator Whitley.
Thank you, Madam Chair. So the almost the last sentence you said sort of triggered something for me. Like, you know, you said, well, I might know what the intent of the legislature was, and I assume you're referring to the 24-week abortion ban. Yes. And I think that's where the rub is, you know, because I don't remember, and I'm asking whether maybe you remember. Do you remember that, you know, in the context of the conversation, was it the intent of folks who were promoting the ban to protect abortion up to 24 weeks? Was that their intention with the statute?
I think the understanding, and I can speak to individual legislators' intent, though some were stated, that the intent was not to protect, using the words protect, but to leave it legal before. And so that is different, and that is different for people to wrap their heads around, protection or legal, and something that is not mentioned in law, does that make it legal or not legal? And so, but the fact remains that it is not protected, and the intent, you know, was written in the law that the Fetal Protection Act would not protect, does not explicitly protect that right. So that's what we're trying to do.
Follow up?
And isn't it true that the Fetal Protection Act was passed before Roe was overturned? And so that bill was passed within the context of Roe that did give women the right to seek abortion without governmental intrusion up to 24 weeks, or up to viability, excuse me. But even so, wasn't it true that some of the folks that, did promote the bans, the 24-week ban, said, we are doing this because of Roe. If it wasn't Roe, maybe we would have chosen something different. Is that your understanding?
That is my understanding, and I think that also is the impetus. That's the catalyst for folks to question in New Hampshire and around the country. Once Roe fell, now where do we stand? Especially since this law was passed before Roe fell.
Thank you.
Yes, Senator Abbas.
Thank you, Madam Chair, and thank you for taking my question. Do you believe that, or have you encountered anyone that is confused, perhaps because the common term people use it, the word ban, without clarifying it's the 24 weeks that before the restriction even would apply?
At the Women's Foundation, we always lead with clarifying information that abortion is legal up until 24 weeks, with exceptions thereafter, because the most important thing is that people know what their options and access are.
And thank you for taking my question. In regards to the language specifically in HB 88, it references individuals. It doesn't say the word woman. It says all individuals. Do you believe that language should be perhaps amended to reflect specifically women?
No.
Thank you.
Are there any further questions? Seeing none, thank you very much for your testimony. The chair will call Kurt Walper. Okay. Morgan Wilson. Okay, when you're ready, let me know.
I think I'm ready.
Okie doke.
Good evening, Madam Chair and honorable committee members. My name is Morgan Wilson. I'm a resident of Concord, speaking in support for House Bill 88. I've emailed the committee my full written testimony, but today we'll keep it brief. I know you've already been here a long time listening to different testimony. I was young, having just graduated college the year before and working at my alma mater through a fellowship when I found out I was pregnant. I was making minimum wage, I was living on campus, and I had no clue what my next step would be after the fellowship ended in 9 months. It was never a question of what my choice would be in this situation. I made my appointment at Planned Parenthood to confirm my pregnancy as quickly as possible, and at the time I was 6 weeks along. And then I made the appointment for the abortion, which had to be 2 weeks out. During this time, the pregnancy and its consequences were all consuming. I felt terrible, I performed terribly at work, and I didn't see most, if any, of my friends. I had a medication abortion, so I took one pill at the clinic and one later that night. I woke up the next morning lighter. The sense of momentum had calmed and my body was still. The future did not fill me with dread any longer. Time stretched forward freely. Pure and simple, my abortion gave me my life back, and I am grateful every day for that abortion. I have found a career path I am passionate about, a job I love, and I'm currently enrolled in a dual degree master's program. I was able to write my own story the way I wanted. I can say with complete confidence that I would not have the life I do today if I had not had access to abortion. And that's what we are fighting for the right of all Granite Staters to control the trajectory of their very lives. That's what I want to protect, and that is what House Bill 88 would protect. This bill would enshrine abortion rights into state law, which is critical because the Supreme Court overturned Roe v. Wade and gave state politicians control over the future of abortion rights.
Overwhelmingly, the people of New Hampshire, like me, believe abortion should be safe and legal. We need our elected officials to act now to protect our rights to make personal, private healthcare decisions. You, as lawmakers, have the awesome power and responsibility to protect the future of our rights here. Please vote ought to pass on House Bill 88 and protect abortion access for Granite Staters. Thank you so much for listening.
Thank you very much for your testimony. Are there any questions? Seeing none, thank you.
Thank you.
The chair will call Leslie Burns. I don't think she's here. The chair will call Carissa Burns. Okay. The chair will call Jason Hennessy.
Well, hello again.
Let me know when you're ready.
I'm ready.
Okay, there we go.
So good evening. My name is Jason Hennessy. I'm the president of New Hampshire Right to Life, and I'm here to represent the pro-life contingent in New Hampshire. We opposed HB 88 on two grounds. First one is that it's a virtue signal with very little substance. Looking back to my undergrad civics course, it was clearly stated that without a constitutional amendment, you cannot bind a future legislature. So the HB 88 would be a virtue signal, would say, oh, this is something that's there, but any future legislature could amend it or replace it or remove it. And it seems as though that the legislature is actually the primary target of the law itself. So what it would lead to would be bills with more boilerplate, which would probably annoy you guys because it's more to read. It would mean that it would mean that there would just be it would instead of creating certainty for the people who want to enshrine abortion, it would create confusion. We don't have laws on a lot of things. Every year, when I file when I'm thinking about my taxes, I don't have to worry about my personal income taxes for New Hampshire. I don't think about it. As far as I know, that doesn't say anything. There's nothing in New Hampshire state law that says I don't have to file my personal income taxes. Same thing if I want to plant things in the garden. From listening to the testimony today, I did not hear any examples of things that would be accomplished. And as an engineer for many years, we would say that this is a solution in search of a problem. In terms of finding out what the law is in New Hampshire, I just did a quick web search for New Hampshire abortion law. I found Wikipedia and Planned Parenthood, which both clearly said that abortion is legal up until 24 weeks. Second thing is that we have to question what we're enshrining into law. Almost everybody would agree on bodily autonomy, except when your rights interfere with someone else's rights. And that's really the fundamental question here is that unborn person a person who deserves rights? Most religions and cultures would agree on that, that the unborn or preborn have rights. The Hippocratic Oath agrees with it. Most atrocities in history take place because of who someone says is a person and who someone says is not a person. I heard a little bit about safety. The fact is, as one of the earlier speakers said, we have no statistics. So we actually don't know if abortion is safe here in New Hampshire. In fact, chemical abortions in other studies have shown a complication rate 4 times higher than surgical abortions. And from what I've read, 1/5 of women who take them experience a complication, and up to 15% experience hemorrhage. So is this the type of thing that we want to put into law, something that's actually somewhat dangerous? Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Senator Whitley.
Thank you, Madam Chair. Thanks for taking my question. You questioned sort of why would we put a right into state law when another legislature can just overturn it? But we do that all the time. If I'm sure you're aware of, just a couple of weeks ago, the Senate passed a parental bill of rights listing all parents' rights right in statute. We do it all the time, even though it would bind future legislatures. Are you aware of that?
I'm not familiar with that bill. I'm sorry.
Okay. And just last week, we also passed a bill protecting the right to a marriage between two people of different races. Are you aware of that?
I am also not aware of that.
Okay. Thank you.
Okay. Are there any further questions? Seeing none, thank you very much.
Thank you, Madam Chair and honorable members.
The chair will call Alexis Simpson. Oh, okay. All right. Sorry about that. It's been a long day. I've gone through everyone who had signed up to speak. Is there someone who wanted to speak who did not sign up? Okay, come forward. Let us know who you are.
Hi, I'm Beth Scare from Nashua. I was listening to those who support the bill breezily referring to abortion care up to 24 weeks. And I just wanted to remind the committee of this printout that I passed out to you that shows what a 23-week abortion looks like. Calling this care is ludicrous. This is brutal. This is grotesque. And to follow up what Jason said about the abortion pill, I mean, that doctor talked about abortions being unsafe before abortion was legalized, but with abortion pills, 1 in 5 women who undergo a chemical abortion will suffer a complication and require further medical attention. Women can face severe bleeding, life-threatening infections, and the inability to have future successful pregnancies requiring emergency medical treatment, surgeries, blood transfusions, and hysterectomies. And that is why they're trying to overturn the FDA approval of RU 486, the abortion pill, because it's not safe. So I'm asking you to ITL this bill. Thank you.
Thank you very much for your testimony. Are there any questions from the committee? Seeing none, thank you very much. Are there any other member of the public who would like to speak to House Bill 88? Okay, seeing none, we're going to go ahead and close the public hearing on House Bill 88. Thank you all for being here this afternoon and this evening. We appreciate all your comments, and thank you for hanging in with us as we got through everybody who wanted to speak.
Madam Chair.
Thank you.
With grace.
Well, that's what we're here for.